Good afternoon, and welcome to today's bill hearings for the Health and Government Operations Committee. This is a virtual committee meeting, so I ask for your patience if we encounter any technological or streaming issues. This bill hearing is being streamed on the Maryland General Assembly's YouTube channel. Today, we will be following a modified version of our normal committee testimony rules. These guidelines have been posted on the General Assembly website. The committee will hear oral testimony from 5 witnesses in favor of the bills, 5 witnesses who are favorable with amendments, and 5 witnesses opposed. A selected witness testifying for one bill will have a total of 2 minutes. Witnesses selected to testify on multiple bills will have 4 minutes total to testify on all of those bills. As in normal practice, bill sponsors will have 5 minutes to present their bill. Please conclude your remarks when you see the timer finish. I just want to reiterate that the ability to listen to and have testimony on multiple bills will take place, and it is a part of our rules that we are able to do that. And so I will be grouping Delegate Cox's bills together. They have similar content as well as the witness list. And the sponsor at that time will have 20 minutes. So today, there are 13 bills on our schedule, and we will begin our hearing today with House Bill 626. And that bill is Delegate Williams. Delegate Williams, are you with us?
I am here.
Oh, wonderful. Good to see you this afternoon. Delegate Williams, you may proceed, and you have a total of 5 minutes for your testimony.
Thank you. Thank you so much, Madam Chair and members of the House Health and Government Operations Committee. I am Delegate Nicole Williams, and I am testifying today in favor of House Bill 626, also known as the Pregnant Persons Freedom Act of 2022. This legislation will prohibit the subjectation of pregnant people or those who have experienced a pregnancy loss or termination to Maryland's criminal justice and/or civil court system. This bill will also protect individuals who provide support to people who are experiencing a pregnancy loss or seeking abortion care. Basically, you cannot go to jail or seek civil damages in court against someone for seeking the care that they choose or against someone assisting another person who is seeking the care that they choose. Over the past several years, we have seen hundreds of cases across our country of individuals being subjected to criminal investigation, arrest, prosecution, and/or conviction for pregnancy loss or the threat thereof. The most egregious attempt of this type of prosecution is the legislation that we saw passed last year in the state of Texas, known as SB 8. However, the bill that is before this committee today, House Bill 626, is not just about abortion. It is about charges filed against a person who is experiencing a physical accident that threatened or ended a pregnancy. This bill is about protecting a person who experiences a miscarriage or stillbirth from being accused of homicide, child abuse, neglect, reckless endangerment, or more. Even here in Maryland, we had an incident several years ago where someone filed a lawsuit in Washington County to enjoin a doctor in Hagerstown from providing abortion care that his partner was seeking at that time. Most people who have been criminalized for pregnancy loss are typically low income and/or women of color. And prosecuting individuals for experiencing a miscarriage or stillbirth is cruel and ignores the root causes of poor pregnancy outcomes and perinatal loss. We want to encourage individuals to get the prenatal care that they need without fear of prosecution or civil liability. This bill does 4 things. 1, a pregnant person is not liable for civil damages or subject to criminal investigation or penalty for terminating or attempting to terminate the person's own pregnancy under any circumstances. 2, the state does not have the authority to criminally investigate or penalize a pregnant person who has experienced a miscarriage, neonatal death related to or failure to act or stillbirth. 3, a person is not subject to criminal penalties or civil damages for aiding, informing, or in any way assisting a pregnant person in terminating or seeking to terminate the person's pregnancy. And 4, a person may bring a cause of action for damages if the person was subject to unlawful arrest or criminal investigation for a violation of these provisions. This bill does not alter any of our current laws as it relates to abortion care, parental consent, or charges for medical malpractice or homicide or manslaughter. In fact, you should have in front of you an amendment that makes it crystal clear that a person will still have a cause of action against a doctor for malpractice if that does indeed occur. And this bill, while we just earlier today voted on House Bill 1171, this bill is still important because while the bill that we passed out of the House earlier today is extremely important in protecting a person's fundamental right to make decisions about their own reproductive health and also to prevent or continue or end a pregnancy, I see this bill as a complement to the bill that we passed earlier today in, again, protecting individuals from criminal prosecution or civil liabilities. And for those reasons, I urge this committee to give a favorable report to House Bill 626.
Thank you, Delegate Williams. At this time, we will hear from your favorable panel. The first witness is Anna Rodney.
Good afternoon, delegates and persons on the committee. My name is Anna Rodney, and I am a practicing doula and birth worker here in Baltimore City. I am here in favor of this bill as a doula, knowing that the trauma of infant loss and pregnancy loss is already traumatic without adding on the inherent judgment of police involvement and or criminalization of a loss. I have supported women in birth who have lost their children and have had to endure grieving the loss of their child, as well as being questioned by police, and this is severely traumatic. I also want to remind everyone here under the sound of my voice that whether or not a child is born a live birth or not, there are postpartum implications for that parent that need to be addressed, and that should be addressed by a medical professional should anything arise. And if a individual is uncomfortable or fearful that they will be judged or criminalized for a loss, they are less likely to enter into the care that they need to make sure that they are safe and that they survive the loss of their pregnancy. So I'm here again in favor of this bill and hope that you can provide a favorable report. Thank you.
Thank you, Ms. Rodney. The next witness that we'll have is Rahula Stroll.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Rahula Stroll, and I'm here representing Planned Parenthood of Maryland. I'm grateful for this opportunity to testify in support of House Bill 626. As our mission states, Planned Parenthood of Maryland believes in providing healthcare to all people, no matter what. Reproductive healthcare in general and pregnancy-related care specifically are already topics that can make patients feel uncomfortable. I myself have in the past lied to a provider about my sexual history because I felt stigmatized in the process of the appointment. Planned Parenthood of Maryland providers know this and strive to make the environment as comfortable, open, and honest as possible. Individuals who do not feel safe accessing reproductive health care may delay or forego that care entirely. Patients who do seek care may also feel uncomfortable disclosing any legal or illegal drug use or any other issues that might affect a pregnancy because they fear repercussions. According to the National Advocates for Pregnant Women, more than 1,200 pregnant people were arrested or prosecuted for stillbirths and miscarriages between 2006 and 2020. In the majority of these cases, the person experiencing arrest or prosecution was Black, brown, or low-income rural and white. As copycat laws for Texas and Mississippi abortion bans seek to ramp up the kind of pregnancy stigma that we at Planned Parenthood combat every day, we are concerned that this atmosphere at best will have a chilling effect on people seeking reproductive health care in Maryland, and at worst that a version of these laws find their way to Maryland. This legislation will help ensure that Marylanders can continue to trust their providers without fear of consequences of seeking pregnancy-related care. Thank you for your time.
Thank you, Mr. Stroll. We certainly appreciate your time today. The next witness that we'll hear from is Farah Diaz-Tello.
Thank you for the opportunity to be here today. My name is Farah Diaz-Tello, and I am Senior Counsel and Legal Director for If, When, How, Lawyering for Reproductive Justice. Throughout my lawyering career, I've witnessed firsthand the devastation caused when people are criminalized for having a stillbirth, ending their pregnancy, or giving birth to a baby who doesn't survive. This has been the unjust circumstance faced by more than 1,200 pregnant people across the country. This has driven home for me the importance of protecting people from involvement of punitive systems during vulnerable moments in their reproductive lives. HB 626 provides exactly the kind of robust protections that pregnant people need. It specifies that they cannot be dragged into civil or criminal legal proceedings because they ended a pregnancy, lost a pregnancy, or couldn't guarantee the birth of a healthy baby. This is sound policy that's wholly consistent with existing Maryland law, which prohibits charging feticide on the basis of a person's act or failure to act with respect to their own fetus. But as hostility towards reproductive freedom increases, greater protection is required, even in states protective of abortion rights. For instance, in California, a woman is currently serving her third year of an 11-year sentence for fetal manslaughter for experiencing a stillbirth, even though California's law, like Maryland's, is clear that pregnant people cannot be charged with crimes based on their own pregnancies. This has led the Office of the Attorney General to issue a legal alert notifying all district attorneys that these charges are unlawful. But because the woman pleaded guilty to a crime that doesn't exist without knowing it, she has to wait for her habeas petition to work its way through the courts. Maryland can't wait and must send a message to DAs and defense attorneys alike that Maryland doesn't criminalize pregnancy or pregnancy outcomes. This is consistent with the recommendations of the American Bar Association, the American Medical Association, and the American College of Obstetricians and Gynecologists, as well as the American Public Health Association. This bill also ensures that people who support others in seeking abortion are free from harassing civil suits or criminal penalties, like Texas SB 8's abortion bounty provision. Thank you for your time. Please support this bill.
Thank you for your testimony today. The next witness we'll hear from is Heather Loeffler.
Good afternoon, committee members. My name is Helen Loeffler, and I am a certified nurse midwife here representing the Maryland affiliate of the American College of Nurse Midwives in support of the Pregnant Persons Freedom Act. I have more than a decade of experience working in women's health and obstetric care, including 6 years providing gynecologic and pregnancy care in Howard County and delivering at St. Agnes Hospital in Baltimore. Currently, I specialize in perinatal mental health. Gynecologic and pregnancy care are intimate healthcare services. Midwives care for women at some of the most vulnerable moments of their lives. Communication and trust are essential elements of our therapeutic relationship. Here is what happens if pregnant people are afraid of personal liability. They do not disclose drug or alcohol use. They delay care for evaluation of pain or bleeding. They see healthcare providers as extensions of the legal system. Here's what happens to pregnancy care. Unethical scenarios where every miscarriage requires investigation. Worsening defensive medical practices, adding cost and burden to the system. Inevitable disproportionate implications for people of color, families living in poverty, and individuals struggling with addiction and other mental illness. Yes, this legislation is preventative. Much of this discussion may even seem theoretical. I'm here to implore you that it is not enough to assume that Maryland will not pass burdensome regulations. It's not enough to hope that prosecutors will show discretion in the application of ethically ambiguous rules. We must unequivocally assure women that healthcare spaces are safe. Thank you so much.
Thank you. Thank you for your time today. The next witness we'll hear from is Mishka Turplin. And forgive me if I pronounce your name incorrectly.
You pronounced it correctly. Thank you. My name is
Awesome.
Mishka Turplin, and thank you for inviting me. I'm here in support of the Pregnant Persons Freedom Act of 2022. I'm an obstetrician gynecologist. I'm also an addiction medicine provider, and I have 15 years of experience working on legal cases. This last several months, my inbox has never been more full, with at least weekly requests for affidavits or other expert consult regarding a person who experienced a pregnancy loss and is facing a charge of manslaughter, child abuse, child neglect, or even, quote, depraved heart murder. The increase in these cases is a direct consequence of state laws restricting reproductive health, including abortion. Given that at least 20% of pregnancies end in a loss, the population health burden of punitive and criminalized statutes is potentially enormous. Protecting patients and providers from criminal and civil prosecution as proposed in House Bill 626 is in alignment with medical ethics, the principles of public health, and the values of Marylanders. Thank you.
Thank you. Next, we will hear witnesses that are favorable with amendments. The first witness is Laurie Ruth.
Good afternoon, committee. My name is Laurie Ruth. I'm the legal director at the Women's Law Center of Maryland. We are here in support of the Pregnant Persons Freedom Act of 2022 with what we hope is a friendly amendment. As you've heard, there are 4 provisions of this bill. I won't go into any detail. I will tell you this, as alluded to in earlier testimony. In February of 2021, the American Bar Association, the oldest and largest bar association in America, passed a resolution opposing criminal prosecution of anyone who has had an abortion or experiences a miscarriage or stillbirth. ABA Resolution 107A further urges jurisdictions to repeal and oppose laws that criminalize people for terminating a pregnancy and clarify that existing laws may not be used to prosecute those who have an abortion, miscarriage, or stillbirth. HB 626 would codify this good public policy. We ask for a friendly amendment to make sure pregnant people know their rights and protections under this law by posting information on the Department of Health Services website. Because this type of behavior, criminalization of women, results in monitoring and targeting women, especially Black and Brown women and low-income people, for all sorts of behavior, we think that passing HB 626 would be a good policy. Just finally, the AMA, the American Medical Association, and other major medical associations have recognized that criminalization of people who self-manage their abortions may prevent them from seeking necessary medical care. Criminalization for pregnancy loss is bad for women and bad for our state. For those reasons, we urge a favorable report on HB 626 with amendments. Thank you.
Thank you. The next witness we have is Melanie Shapiro. Favorable with amendments.
Thank you, members of the committee. I'm Melanie Shapiro. I'm the Public Policy Director with the Maryland Network Against Domestic Violence. Here with what I also believe to be a friendly amendment, which is very similar to what Ms. Ruth said, which is to make sure that people are aware of their rights under existing law, and to think that a woman or a person who has experienced domestic violence and may have an unintended pregnancy as a result of that and could then be criminalized for that. Somebody could also, a victim of domestic violence, experience an unintended pregnancy loss as a result of violence that they experience. And without these necessary protections and ensuring that we have such policies in law in Maryland, they could be subject to either criminal or civil penalties. It's important not only for them to not be subject to those penalties, but for them to be aware that they are not. So for all of those reasons, we are urging a favorable report with amendment on House Bill 626.
Thank you, Ms. Shapiro. The next witness we'll have is Lisa Jordan. Ms. Jordan, I think you're on mute. I see your mouth going.
Sorry about that. I thought I fixed that. All right, good afternoon again. Madam Chair, members of the committee, I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. We're also here in support of House Bill 626 with the amendment described by my colleague, Ms. Lori Ruth. Abortion access is a critical piece of healthcare for rape survivors and for survivors of reproductive coercion. And House Bill 626 with amendments is vital for these survivors because it will protect the people who help survivors. It will prevent laws that encourage lawsuits or encourage prosecution of the helpers of rape survivors. These are hotline workers. These are attorneys at the Sexual Assault Legal Institute and other legal services programs. These are advocates, counselors, people who are working at rape crisis centers and volunteers at our sexual assault programs across the state of Maryland. But it's also moms, sisters, dads, brothers, people supporting their family members. This is Uber drivers, therapists, friends. The model provided by Texas's Senate Bill 8 is a threat to all of them, and this bill, House Bill 626, will protect them. Survivors of rape and reproductive coercion need abortion care. Almost 3 million women in the US experienced rape-related pregnancy. 5% of women who are raped between the ages of 12 and 45 become pregnant as a result of those rapes. We need to make sure that these survivors have access to the care that they need. Reproductive coercion is a form of intimate partner violence where a woman's partner tries to coerce reproductive decisions by preventing access to or tampering with birth control. These women also really need the help that this bill will provide. Survivors of rape and reproductive coercion need access to abortion care, and they need access to the people who will help them. And so for those reasons, the Maryland Coalition Against Sexual Assault urges a favorable report on House Bill 626 with amendments.
Thank you, Ms. Jordan. We have heard from all of our favorable and favorable with amendments. So at this time, I would like to ask any committee members that have questions of this panel. All right. I don't see any at this time. I will now take the unfavorable witnesses. The first one we have is Ella Ennis. Is Ms. Ennis with us today?
We're waiting for them to unmute.
Oh, there we are. Okay, I'm sorry. Thank you, Madam Chairman and members of the committee. I'm Ella Ennis. I'm here to represent the 1,480 members of the Maryland Federation of Republican Women. And the Federation strongly opposes House Bill 626. This bill not only eliminates any restrictions on abortion at any point from conception to birth, but it also eliminates any penalty for infanticide by lack of action. The bill specifically states that nothing in this section applies to an act or failure to act of a pregnant person with regard to the person's own fetus. The section may not be construed to authorize any form of investigation or penalty for experiencing perinatal death related to failure to act. Webster's Dictionary defines perinatal as the period from 20 weeks of pregnancy until 28th day of newborn life. A person could cause the death of a newborn baby by failure to act by withholding either food or water or keeping them in subjecting them to extreme temperatures or not giving them necessary medications. This would not allow prosecution of what is by all definitions premeditated murder. The extension of ability to end the life of a child after birth also is inferred by 1171, where it says that the right of reproduction is not limited to the ability to start or to continue or to end a pregnancy. Our children are our future. They are all precious, and this legislation is evil. We ask you to please give this House Bill 626 an unfavorable report.
Thank you, Ms. Ennis. The next witness we'll hear from is Olivia Summers.
Thank you. I have a point of clarification before we start my time, if that's okay.
What are you?
I am testifying against House Bill 626 and 50, and then I'm testifying in favor of House Bill 1317. And you stated earlier that we get 4 minutes total for all bills. Does that include favorable testimony and unfavorable testimony being separate?
So 626, you have 2 minutes on that particular bill. The bills that I was referring to of grouping multiple bills were House Bill 583, 1360, 1369, and 1364. Are you on any of those?
No, I'm not.
Okay, well then we'll add 2 minutes.
Okay, thank you.
For this bill, and I'll have you call up again. Thank you.
Okay, thank you. My name is Olivia Summers, and I am Associate Counsel for Public Policy with the American Center for Law and Justice. And today I'm testifying in opposition to House Bill 626 on behalf of the ACLJ and over 500,000 concerned citizens, including over 6,400 from Maryland who oppose this bill. You have my full written testimony regarding HB 626. House Bill 626 is extremely concerning as it proposes a revision to the fetal murder manslaughter statute that would severely limit the investigation of infant deaths. As the bill is currently presented, it includes the term perinatal death, which is not limited to a pre-birth death, but includes the death of a newborn. The term perinatal applies to the mother and her child, both during the latter stages of pregnancy and early in the child's life, encompassing anywhere from 1 to 4 weeks post-birth. Notably, in Maryland's bill's new legislation concerning doulas, the perinatal term extends to 180 days post-birth. House Bill 626 reaches well beyond the realm of a pregnant person's freedom, and it handcuffs the investigation of newborn deaths. The death of a newborn post-birth is not abortion, and to prohibit the investigation into the deaths of newborns is directly contrary to the current efforts in Maryland to prevent infant mortality and morbidity through the review of fetal and infant deaths in Maryland. Maryland is a safe harbor state. Moreover, an estimated 1 to 2 million couples in the United States are waiting to adopt a child. And 62% of children who are adopted through private adoptions are placed with their adoptive families within a month of birth. Thus, if the purpose of this bill's sponsor is to allow women to be free from parenting an unwanted child, that is already possible through many different avenues that do not involve the death of an innocent baby through neglect, otherwise known as infanticide. And we strongly oppose this bill. Thank you.
Thank you, Ms. Summers. The next witness that we'll hear from is Patricia Strobel.
Can you hear me now? Thank you, Madam Chair. Okay, thank you. My sister had 3 abortions. They were unplanned, convenient pregnancies. And at that time, she just thought it was a blob of tissue. However, they're not blobs of tissue, and I want everyone to stop and think about what this bill is. I'm holding up a picture. This is a 2-month-old or 8-week-old baby in the womb. It's a fetus. A fetus means little one in Latin. He or she is a vulnerable human being with a beating heart, 8 weeks, a beating heart. It's not a dog, it's not a cat, it's a human being with hands, arms, a head, stomach, legs, and feet. I would like everyone to please look at this child. This is what we're killing. Again, it has a beating heart. They're innocent. They're in the womb. The womb should be a safe haven. And sadly, we are in a country that does not embrace life. These are my 3 boys. They were adopted from a wonderful country that embraced life. Their first mother chose to protect them. The country took care of them, counseled them, housed them, gave them training. It is a beautiful country which embraced life, and now they have 2 mothers that love them dearly. Those in favor of this have become intolerant of the fetus and those children that are vulnerable. HGO 626 legalizes the right to kill an innocent unborn human being with a beating heart. And if we accept that a mother can kill her own child, how can we tell people not to kill each other? How are we any different than Putin, Jinping, Bin Laden? Abortion is war. It's war against the child and is the greatest destroyer of love and peace. And any state that accepts abortion is not teaching its people to love, but to use violence to get what they want. Vote no, please, and instead advocate for life, a life-affirming bill that protects both the mother and the child, regardless of circumstances. Please bear in mind this little person
Thank
right
you,
here.
ma'am. Ms.
they have a
Strobel, your time
meeting-
has ended. I need you to conclude.
Okay, sorry, thank you.
You're welcome. Thank you. The next witness we hail from is Laura Bogley.
Thank you, Madam Speaker Pro Tem. Before you start my clock, if I could ask you to stop the clock, I also have a point of clarification, please.
Yes, ma'am.
Yesterday or the day before yesterday, Maryland Right to Life, on behalf of several different witnesses today, reached out to the HGO committee, and we were instructed by staff that the limitation on speakers on signed up for multiple bills would cover, in fact, all bills for only a total of 4 minutes. So I would like to encourage the speakers or the members of this committee to move for a rescheduling of the hearings today, because this is a great disadvantage to witnesses who were given misinformation from the committee.
Okay, ma'am, we were not going to reschedule. We're going to continue with our hearing, and it is in our rules to state that if there are multiple bills that you're testifying on, if they're grouped together, then you do have a maximum of 4 minutes to testify. That is in the HGO rules. Thank you for your inquiry, but I would like to hear from your testimony now, and you have 2 minutes.
Thank you, Madam Speaker Pro Tem and members of the committee. I'm Laura Bogley, Director of Legislation for Maryland Right to Life, and we urge you to issue an unfavorable report on the Pregnant Persons Freedom Act. This bill is the abortion industry's attempt to fearmonger and fundraise in Maryland. There are no criminal penalties in existing Maryland law for a woman who has an abortion, miscarriage, or stillbirth. There are 2 operative provisions of this bill. The first is that the bill shields sexual predators and abusive partners. Sexual predators, including sex abusers and even sex traffickers, use abortion as a tool that enables them to continue to victimize women and girls without consequences. With the proliferation of chemical abortion pills and regressive abortion policies that deny pregnant women care through a licensed physician, we will witness a dramatic increase in abortion coercion and sex crimes. Secondly, the bill prohibits law enforcement from investigating suspected infanticide or the death of the baby within the first month after birth. A woman or abusive partner would be shielded from prosecution for the death of a child before or after birth for any reason, including by inaction, which could include neglect, starvation, or abandonment of the child. Finally, the title of the bill in replacing the word pregnant woman with pregnant person is just a shameless publicity stunt. For the last 50 years, militant feminists have been telling men that they have no right to an opinion on abortion. However, as more women become ambivalent about abortion, the abortion industry is attempting to expand their base of support by pandering to the LGBT community. However, the LGBT community should be among the loudest voices to fight for the rights of marginalized human beings like the preborn. We urge you to issue an unfavorable report on this bill. Thank you.
Thank you. Our last unfavorable witness on this bill is Michael New.
Can everyone hear me?
Yes, sir.
All right, great. Name is Michael New. I am a professor at the Catholic University of America. I'm also an associate scholar at the Charlotte Lozier Institute, the research and education arm of Susan B. Anthony List. I'm testifying in my capacity as a concerned citizen. I live in Hyattsville, Maryland. I'm here to request a negative report on HB 626. With all due respect, I think this bill is just political theater. Abortion is legal in Maryland. There are no penalties for miscarriage. There are no criminal penalties for stillbirth. What concerns me the most about this bill is the language. And if you read the language, it prevents any form of investigation or penalty for a person experiencing a perinatal death related to a failure to act. And I want to be clear about this. This is perinatal, not prenatal. Perinatal is nowhere defined in the Maryland Code. And at other times, it can be defined as anywhere from 1 to 4 weeks after birth. So my concerns, if this bill is passed, it would make it hard to investigate abandonment. It would also make it hard to investigate infanticide. And sadly, those are situations that do happen from time to time. And again, I think when they do happen, they deserve a full and thorough investigation. I'm also concerned this bill would make it hard to investigate abortion in some cases. When you make it hard to investigate abortion, you shield sexual predators, you shield sex abusers, and you shield sex traffickers. Again, these sex abusers use abortion as a tool to allow them to continue to victimize women and girls. As such, I recommend a negative report on this piece of legislation. Thank you.
Thank you. That concludes our unfavorable panel. At this time, I will take questions from the committee. The first delegate, Delegate Bagnell, followed by Delegate Kipke.
Thank you, Madam Chair. And I'm challenged on how to frame this question because I was hoping that Ms. Belkov would be here so I could ask it. But we have unfavorable testimony from the Board of Ed in Anne Arundel County, and I did reach out to the Board of Ed for further clarification, and they did not weigh in on this bill. So I don't know if Ms. Bogley can speak to, was she speaking on behalf of the unfavorables that signed up without testimony?
Thank you, Delegate, for the question. I am not speaking on part of the Anne Arundel County Board of Education.
Okay, thank you. Thank you, Madam Chair.
Delegate Kipke.
Thank you, Madam Chairman. Since time was cut short, I wanted to just see if Laura Bogley had anything else that she'd have time to say that she'd like to add.
Well, thank you, Delegate. I have much that I would like to add, but again, we were underprepared because of misinformation. We specifically asked for clarification. We listed the number of bills and we were not told they would be grouped by sponsor. We were told we'd be told that they would be grouped in their entirety. So if I may, I would just like to add on the infanticide bill, if I may, that it's unnecessary because the Maryland legislature has enacted a Freedom of Choice Act in 1991 to codify Roe v. Wade in state law. If Roe is weakened or overturned, abortion will still remain legal in Maryland for all 9 months of pregnancy for any reason. And there are no provisions in Maryland law to prosecute a woman for abortion, miscarriage, or stillbirth, as several witnesses have already said. In 2013, a late-term abortionist practicing in Maryland killed a woman whose name is Jennifer Morbelli. She was transported across state lines to receive a late-term abortion prohibited in her state, but allowed in Maryland. The state allowed that abortionist to continue practicing, and he is now being sued for the brutal botched abortions of 2 women in May of 2020, who both experienced perforated uteri and remnants of their baby's limbs and head forced into their abdominal cavities. The state refused to investigate until prompted by Operation Rescue, but any reports will not be made public. So as you can see, the needs of women in the state are not being addressed. We also have a safe haven law in Maryland, a safe haven program that the state is not implementing. They're not providing public education and notice about this bill. Our state safe haven law is weak because it only protects women from criminal prosecution who safely abandon their babies within the first 10 days after life. This bill would allow a woman to kill her baby for the first 28 days after birth. So our safe haven law is not even as extensive to protect those women and children in the first month of life. So we would ask at least the state to consider strengthening laws like safe haven to give women real alternatives. We obviously, women, we've heard from the proponents today that women are having serious problems that are not going addressed by the state. The state's abortion minded, but if we prioritize funding and put our efforts together to provide those life-saving alternatives and really empower women to choose life for their children, we can resolve those problems. But killing children and covering up the crimes of parents or abusers is not the solution to this problem. Thank you, Delegate.
Thank you.
Any other questions from the committee? I don't see any. Oh, I'm sorry. Delegate Krebs.
I have a question. I'm not sure who's best to answer this, but I've read in different bills the term perinatal. Can someone define to me what the difference in prenatal and perinatal is? I'm not sure who is.
Dr. New, do you want to take that for Delegate Krebs, please?
Well, the concern I have is that perinatal is really nowhere defined specifically in the Maryland Code. So it's a question that deserves a better answer than I can really give. Prenatal typically refers to while a woman's pregnant. Perinatal at times, depending on who's writing the definition, can be defined as any time from 1 to 4 weeks after birth. So that's a concern that me and many other witnesses against this bill have expressed during our testimony today.
Do you know if it's defined anywhere else? Because I've seen it from 20 weeks to 28 days after birth. All right. So is it defined in like federal law or anything?
May I take this question?
Go for it.
Sure.
No,
Okay,
actually, Mr. New is still responding to.
I'm sorry,
Delegate
Madam Chair.
Krabs.
I'd be happy to let
Mr. New,
Ms. Summers respond. I think that she wants to
but we
chime
have
in here.
one question per answer, so person.
All right, well, maybe somebody could just get me the answer to that question
Sure,
and see if it's defined
absolutely.
anywhere.
Whomever's
you.
responsible for securing that information, if they could submit that to the committee, and we will make sure that Delegate Prep has it if you don't send it to her directly. Thank you. The next witness is Delegate Saab. Excuse me. The next delegate we're going to hear from is Delegate Saab, followed by Delegate Shalega.
Thank you, Madam Chairman. Dr. New, are you an OBGYN doctor?
No.
Okay, maybe somebody on, if there is a panel, doctor, has any doctor on this panel giving birth to a person that's not a woman? Just a person that's not a woman? Because I know in the bill it says a person. And I'm just curious if, obviously, why are we using the term? I mean, only women can get pregnant. So why are we using this term? Maybe someone can shed some light on that.
I'm an obstetrician gynecologist, and I can speak to that if you wish.
Yes, please.
Yes, so not all women become pregnant, and not all people who are pregnant identify as women. And so the term pregnant person is inclusive of that. So it includes people who have a uterus who may or may not identify as women, who may or may not become pregnant.
Okay, but physiologically, they're still women. Thank you. Appreciate you answering the question.
Delegate Shalega.
Thank you, Delegate Sample Hughes. Olivia Summers, can you tell us perinatal, what that means?
Sorry, I had to find the unmute button. As was stated earlier, it is not defined, but there is a section in the Maryland Code when referencing doula services that discusses the difference between perinatal and prenatal. Prenatal is before birth, and perinatal, according to the Maryland Code with reference to doulas, covers up to 180 days post-birth. Perinatal term refers to the care for infants after birth and before birth, starting at 20 weeks or so. So it's late term pregnancy. And then it also refers to care for a woman who is pregnant, late term pregnancy and post-birth. So that's the difference. Prenatal is exclusive to pre-birth, and perinatal covers a wide range. It is not thoroughly defined anywhere, and it does range from a week to up to, according to Maryland Code, 180 days.
Thank you so much.
Are there any other questions from our committee? Okay. Not seeing any, this concludes the hearing on House Bill 626. The next bill we will hear is House Bill 1335. That is also sponsored by Delegate Williams. Delegate Williams, you have a total of 5 minutes to present your bill.
Thank you so much, Madam Chair and members of the Health Government Operations Committee. I'm Delegate Nicole Williams, and I'm testifying in favor of House Bill 1335, prenatal care, drug, and alcohol testing and screening consent. This bill will prohibit physicians or other health professionals from performing drug and alcohol testing on pregnant or perinatal persons and their infants without their informed consent. This legislation comes as many women who belong to marginalized communities face inequity in our healthcare system. And oftentimes these women and their babies are subject to drug and alcohol screenings without their knowledge. We see in healthcare facilities across the nation that typically poor women and women of color are drug tested at far higher rates than white and middle and upper class women. Black and brown children face the greatest consequence of this practice, which may result in being removed from their homes and placed in the foster care system that may not always have their best interests at heart. A positive result can sometimes spell disaster, with newborns being separated from their families and mothers being forced to enter into drug treatment. A positive test result by in and of itself, however, is not always indicative of a current substance abuse disorder and a mother's ability to be a good parent. Denying them the chance to show their ability to be a good caretaker only further exacerbates the trauma and anxiety felt by both the parent and the child. Passing this bill will show that this legislature is committed to ending unjust family separation and favors keeping the family unit together if possible, and committed to dismantling the structures that perpetuate racism in our healthcare and foster care systems. In doing so, we can reaffirm the opportunity for everyone to be part of a whole, loving family. And for these reasons, I urge this committee to give a favorable report to House Bill 1335.
Thank you, Delegate Williams. The first member of your panel will be Natasha Kofani. And Delegate, do you wish to give any of your remainder time to anyone on your panel?
I can give the remainder of my time. I think Dr. Tefler is signed up as favorable, and the remainder of my time can go to him.
Okay, when I find him, I'll let you know. Okay, thank you.
Good afternoon. I'm Natasha Kalfany. I'm an attorney at the Parental Defense Division at the Office of the Public Defender, and I am testifying in support of HB 1335. One of the arguments that you will undoubtedly hear in opposition to this bill is that doctors will not get consent to test infants who have been exposed to substances. This would no doubt be the exception and not the rule. This is not a good enough argument to take away someone's constitutional right to direct the medical care of themselves and their child. This bill creates opportunities. Medical providers can be proactive in providing comprehensive care for pregnant women with substance use disorders to help them safely stop using during pregnancy. Currently, only 25% of treatment centers nationally will treat pregnant women. Providers can put together birthing and care plans for women with substance use disorders that will assist with substance use treatment and the care of their infant after birth. They can also provide more education to their patients prior to birth, educating them of the need for testing and the risk of such in the final months or weeks leading to birth. There are ways that medical providers can adjust and provide for the health and safety of newborns that may be substance exposed, while at the same time respecting the rights of mothers and obtaining informed consent. It is important to recognize and understand women who may give birth to substance exposed newborns are not monsters who do not care if their child lives or dies. They are women who have used a substance for any number of reasons, but who care about their children and want the best for them and would consent to whatever care is in the best interest of their newborn child. In addition to these statements and what I submitted in my written testimony, I would ask that you all support a favorable report of HB 1335. Thank you.
Thank you so much for your testimony. The next witness will be Mikisha Turplin. And you will also have the remainder of Delegate Williams' time.
Thank you. Thank you very much. My name is Mishka Turplin. I'm a physician. I'm double boarded in both obstetrics and gynecology and in addiction medicine. From my vantage, House Bill 1335 is primarily about human rights and social justice. The language of the bill, in particular, the language about informed consent for drug testing, is consistent with professional society and public health guidance from organizations including the American College of Obstetricians and Gynecologists, the American Society of Addiction Medicine, the American Academy of Pediatrics, CDC, SAMHSA, and even the World Health Organization. Drug tests are of limited clinical utility during the birthing hospitalization. They are often performed due to provider misinformation regarding Captocara and without adequate consent. When we don't disclose to a patient the reason for a test, how the information from the test result is shared, and the potential consequences of such information sharing, we are violating basic tenets of medical ethics. The information from a drug test can be of deleterious consequence for a pregnant person, their children, families, and their community. How drug testing is performed and responded to within hospital settings is a master class in implicit bias, racism, and structural inequity. The current landscape of, quote, test and report targets poor people, Black and other racialized minorities, and immigrants. It operationalizes discrimination and perpetuates racial inequities. House Bill 1335 is a step in the right direction. It aligns care with medical ethics, empowers patients, and addresses historic injustice. So I have more time.
Only if you
So
need
I
it,
guess,
sir.
yeah, if you want, I can drill down to the limitations of what a drug test is and what it isn't. If our concern is identifying people with a substance use disorder such that they can receive access to quality treatment, a drug test is the inappropriate way to do it. Drug tests really only capture metabolites that are present in the biological compartment at a specific moment in time. The test itself is a poor test with multiple sort of false positives as well as false negatives. We only capture certain substances. Some things stick around for, just days, hours to days, and other ones like cannabinoid metabolites stick around for weeks to months. So therefore, it's not even a good test of recent exposure. Plus, whether or not, somebody has a positive drug test is of no relationship to whether or not that infant is at risk of abuse or a neglect. It's not a parenting test, and it's certainly not a moral test, but that is how we utilize it. So with that, I'll stop and thank you.
Thank you. Thank you for testifying. The next individual we'll hear from is Tanae Harris.
Thank you, Madam Chair and members. My name is Tanae Lynn Harris, and I am the director and co-founder of the Bloom Collective in Baltimore City. We provide holistic care to mamas and birthing persons along the preconception, pregnancy, and postpartum period. I am testifying today in support of Bill HB 1335. Test and report practices cause the unnecessary separation of mothers from the newborns, which causes incredible harm to families and children. We know that mothers and parents are a treatment and healthcare for their children. Furthermore, keeping children with parents can prevent trauma that might lead to chaotic substance use. Supporting pregnant and parenting people with their substance use is better for families than separating mothers from their children. I myself was drug tested without my consent with giving birth to my son in 2015. I was completely unaware about the drug testing being done on me until I did my first COVID-19 test in 2020 at the Baltimore Convention Center. Upon receiving my results, I saw an extensive list of drug testing done on me during my time of giving birth. Although this problem was not new to me, it was new information to process and a re-traumatization about my birthing experience. I thought to myself, what would my life be like if for a moment I decided to partake in substance or drink a glass of wine? Perinatal mood and anxiety disorder was a huge part of my pregnancy and postpartum journey, and I could easily have looked for an escapism. Our clients and people in my community have growing concerns about the quality of their care and blatant disregard for their humanity because of racial injustice. What would it be like if we had rather ensured that folks had all that they needed to live their most joyful and fulfilled lives? Obtaining informed consent can help build in a world where the dignity and integrity of all families is valued and supported. We must end racial inequity in the surveillance and criminalization of drug use and stop the womb to foster care pipeline. We must invest in our communities, not drug war tactics. Between 2004 and 2014, foster systems spent between $29 billion and $32 billion every year in federal, state, and local dollars on child welfare surveillance and control. In drug war waged by the foster system, the federal government poured unprecedented.
Em, I need you to wrap up. Your time is up.
Oh, sorry.
Go ahead and wrap up. Thank you.
Okay. We support Bill 1335 and ask that you support this bill favorably. Thank you.
Thank you kindly, Ms. Harris, for your time today. The next witness we'll hear from is Emma Roth.
Good afternoon. My name is Emma Roth, and I'm a staff attorney with National Advocates for Pregnant Women, a legal organization dedicated to the welfare of pregnant people and their families. HB 1335 would provide critical protections for perinatal patients. Hospitals routinely drug test perinatal patients without their knowledge or consent and in the absence of any medical justification. Hospitals proceed to report test results to child welfare authorities, thereby exposing new families to traumatizing investigations and family separation. This practice, known as test and report, has a negative impact on maternal and neonatal health and is widely opposed by leading medical organizations, including the American College of Obstetricians and Gynecologists, or ACOG. ACOG has stated that drug testing and reporting without informed consent may, quote, dissuade people from seeking prenatal care and may unjustly single out the most vulnerable, particularly women with low incomes and women of color, end quote. Safeguards in test and report are essential in light of the punitive outcomes that perinatal patients face. NEPW has documented more than 1,600 cases in which women were arrested, prosecuted, detained, or forced to undergo medical interventions that would not have occurred but for their status as pregnant women. A significant number of these cases originated from hospital reports. Maryland is not exempt from these disturbing national trends. In Kilman v. State, the Court of Appeals unanimously reversed the reckless endangerment convictions of 2 mothers after their newborns were tested without their consent. Although the decision protects against criminal charges based on pregnancy and substance use, it does not prevent hospitals from engaging in non-consensual testing and reporting in the first instance, or prevent families from facing traumatizing investigations and family separation. HB 1335 would close this gap. We urge Maryland to be a national leader in protecting perinatal patients' right to informed consent and strongly support this bill. Thank you.
Thank you. The next 2 witnesses you'll hear from are favorable with amendments, the first being Allison Taylor.
Hey, sorry, I had a little bit of difficulty getting off of mute. Good afternoon, Madam Chair and members of the committee. My name is Allison Taylor. I'm here on behalf of Kaiser Permanente, favorable with amendments. We have a couple of concerns about the bill as drafted. You know, the proponents have raised a lot of important issues here, and we thank the bill sponsor for bringing this bill forward. Concern that I have is that the form that's required to be developed by the department here is required to describe the potential medical, legal, collateral consequences of a positive drug or alcohol test or screen. My concern with this language is that it would be really difficult to envision all the potential collateral consequences here, and would want to make sure that in development of this, a patient would not think that this is presenting the full spectrum of issues that would be available to them. So we'd recommend against using just a form created by the department as a mechanism for this. I think the proponents, though, raise a lot of really important issues. So in lieu of this, we'd recommend that the committee study this over the interim, and we'd be happy to work with the proponents on this important issue, and thank the sponsor for bringing the bill forward this year.
Thank you, Ms. Taylor. The next witness we'll hear from is Jane Krinke.
Thank you. Good afternoon, Madam Chair and members of the committee. My name is Jane Krinke. I'm here on behalf of the Maryland Hospital Association's 60-member hospitals and health systems, and we're in support of House Bill 1335 with amendments. Maryland's hospitals are committed to improving maternal health outcomes. We are engaging with our state partners to support these efforts, including through Maryland's State Integrated Health Improvement Strategy, which includes population health goals addressing maternal and child health and racial disparities. And we really appreciate the sponsor raising this very important issue. As written, though, this bill raises some concerns that we fear could impact the safety and well-being of the mother and newborn. Maryland birthing hospitals universally screen for drug and alcohol use upon admission to labor and delivery. The decision to screen universally aligns with the American College of Obstetricians and Gynecologists recommendation and helps reduce provider bias and potential missed cases. By singling out drug and alcohol screening and testing, we're concerned this could serve as a barrier It could cause unnecessary fear and could lead more mothers to refuse screening and testing. This could have a domino effect, resulting in the appropriate services and supports not being offered and no screening and testing for the newborn. Consent for testing is sometimes built into the hospital's overall consent for treatment process. When a patient declines testing, often they're asked to sign a declaration stating they're declining, and the form often allows the patient to consent to test the newborn. So since newborns are tested if the mother's positive and only with consent, there's a concern that there may be newborns with neonatal abstinence syndrome who would not exhibit symptoms and be sent home without proper treatment. It's also important to note that if the mother tests positive, this alone does not meet the state's definition of a substance exposed newborn and does not result in an automatic referral to the Department of Social Services. So our amendments we're recommending is removing the requirement that the Department of Health create a separate consent form for screening and testing, to remove the requirement that the screening be within the scope of the perinatal care, and finally, that the Department of Health, instead of creating consent form, work with DHS to create informational materials. So thank you for your time and consideration.
Thank you for your testimony. At this time, are there any questions for our bill sponsor or any of the favorable witnesses from the committee? Not seeing any at this time, I would like to now move to the unfavorable witnesses. The first witness is Vince McAvoy.
Thank you so much, committee. I appreciate this. I want to bounce off what was just said by Kaiser Permanente and talk about how Washington, D.C. defines neglected child. Quote, a child who is born addicted or dependent on a controlled substance or has a significant presence of controlled substance in his or her system at birth. Status, so that's their definition. It's a universal definition. The status of neglect is just as true for children born to a mother on drugs such as marijuana. Perinatal is by definition, you're showing. This is one definition. You're visibly pregnant. And so when I hear Kaiser say that they are universally testing, there is no bias. There's an issue where people are saying, please don't accuse us of drug use, even though that seems to be popping up. If that's popping up, where is the concern for the child? Where is the concern for the father of that child, who might want to be concerned about how his child is going to be growing in a womb that is drug damaged? I would say that this is, we call this abortion day. This is an offshoot when you have such a focus of killing children that you're no longer even concerned about their health in the womb. That they don't want to discuss drug use, that they don't want to discuss the impact on the child. So again, I urge a strong unfavorableness and put this in perspective. If you go to a job, they can test you for alcohol, they can test you for drugs as well. They can test you for alcohol on the roads within certain constitutional parameters. And now we're in a day and era where we're sticking swabs up our noses for a cold, but you're telling me that it's too much. It's a bridge too far to test for the very children in the environment that they have to live in for the next 9 months. I also want to echo what Laura Bogley said. This whole thing has been a mess up about how the bill hearing is going to be, and I am going to be speaking on other bills.
Mr. McAvoy, you'll need to conclude. You'll need to wrap up.
Thank you. I'll do that right now. That don't vote for this bill, vote for this bill and compare these things. They'll help you. Thank you so much.
Thank you. The next person we'll hear from is Pam Casemeyer.
Hello, members of the committee. Pam Casemeyer here on behalf of the Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and MedChi. This is one of those tough issues. I think I probably line up better with the support with amendment with the Hospital Association and Kaiser, but our concerns were significant enough that I felt like they felt like they needed to raise this as an opposition, but not to the objectives. They absolutely, as the proponent said, ACOG's guidelines, national guidelines, incredibly in favor of informed consent, have been working for years on this issue to help not stigmatize these women, get them the appropriate care, not test without consent or any of those other issues. But the concern is this creates a separate consent form. I think there's some suggestions made by the Hospital Association, by Kaiser. We've talked with the proponents as well. We need better education and outreach. If there's ways to help women understand these issues better, maybe that's what we should be focusing on. But creating a separate consent form is very unusual. The provisions of the consent form, and that's really what this bill does. It creates a separate consent form with a lot of information that could either be confusing or in some ways create additional stigma, because someone says, oh, well, I'll consent to all of this, but I'm not signing this form. And immediately the lights go off. Well, why aren't they signing this form when they signed everything else? As opposed to incorporating informed consent, which everyone should have, into the normal consent process with adequate education that there's an understanding of the process. So we just feel like the intent, thank you, Delegate Williams, is very notable, but we're not, we have a lot of concerns and objections to the actual approach used for that objective.
Thank you, Mrs. Case-Meyer. Next witness we'll have is Laura Bogley.
Thank you again, Madam Speaker Pro Tem Laura Bogley from Maryland Right to Life. I'm just going to wing my testimony here because I was told I would not have separate time to testify on this bill. But Maryland Right to Life, of course, believes that pregnant women suffering from addiction absolutely deserve help, not prosecution. Medical providers, however, under current Maryland law, are mandatory reporters of suspected child abuse and neglect. This law is not punitive against mothers, but was enacted to protect the welfare of children in the state. If you've ever seen a drug-addicted baby after birth, they require urgent medical intervention. Physicians, medical providers cannot provide adequate care for these children suffering addiction if they are not authorized to do immediate urgent intervention, including the necessary tests and medical screening that they need to do in order to determine what is that appropriate level of medical intervention. So this is going to have potential dramatic effects on both the children and the mothers, who of course want the best welfare for the child and want them to have medical intervention. So I think the concern is about who this is really protecting. Obviously not the children, not really the mothers. We talk about restorative justice. Again, what justice will there be for a mother if her child dies or is otherwise injured as a result of her addiction, of course, not wanting to hurt her child? But the bill also can be exploited by the abortion industry. And I think it goes hand in hand with all of the bills that we've seen today and throughout session, shielding abortion providers, especially lower skilled non-physician abortion providers who are distributing chemical abortion drugs. These women are being sent to ERs. They often have failed abortions. This is going to be affecting emergency personnel who cases for ER cases of abortion pill complications have skyrocketed 500%. I believe this bill will shield abortion distributors, and that's why we strongly oppose it and urge your unfavorable report. Thank you.
Thank you. At this time, we'll move to questions from the committee. I don't see any at this time. This will conclude the bill hearing for House Bill 1335. The next bill we will hear is House Bill 1317, Delegate Rose.
Thank you, Madam Chair. Good afternoon, Delegate April Rose for the record, here to present House Bill 1317, the Informed Consent Woman's Right to Know Act. This bill gives a woman considering abortion the right to know the medical risks of abortion, alternatives to abortion, and non-judgmental, scientifically accurate medical facts about the development of her unborn child before making this permanent decision. This bill will guarantee women access to these facts, information, and also options that are essential components of genuine choice. 37 state legislatures have adopted informed consent laws. In a national Gallup poll, 87% of Americans favored a law requiring doctors to inform patients about risks to abortion before performing the procedure. This same poll also found that 69% of Americans favor a law requiring women seeking abortions to wait 24 hours before having the procedure done. The 24-hour reflection period gives the woman time to weigh her decision and all of the alternatives provided to her by her physician. When weighing a decision such as the ending of a pregnancy, I think more information, full disclosure of risks, alternatives, and supports available to the pregnant mother are very reasonable. If abortion is considered legal health care, then it certainly requires a woman's informed consent. The Sixth Circuit of Appeals upheld the Tennessee informed consent law, declaring, quote, "Before making life's big decisions, it is often wise to take time to reflect." Time to reflect. A simple 24 hours is certainly reasonable. I thank you for your time. I thank you for your consideration, and I respectfully request a favorable report on House Bill 1317. Thank you, Madam Chair.
Thank you, Delegate Rose. The first witness we'll hear from is Zach Tomlin. Okay, Mr. Tomlin doesn't appear to be here. I'd like to move to the next witness, Donna Harrison.
Thank you, Madam Chair. Thank you for allowing me to address this committee on an essential right of each woman, the right to informed consent prior to undergoing a procedure. I am Dr. Donna Harrison, MD, a board-certified obstetrician and gynecologist, and the Chief Executive Officer of the American Association of Pro-Life Obstetricians and Gynecologists. I submit this testimony on behalf of over 6,000 reproductive health medical professionals across the United States. It's universally accepted throughout the medical profession that all patients have a right to informed consent before any procedure or drug is administered to that patient. House Bill 1317 ensures that women are given the elements required for informed consent: the diagnosis, the details about the abortion, the burdens, the risks, and the expected benefits of all options, including the option of not having an abortion. HB 1317 ensures that women receive the truthful and relevant information which they need in order to understand the nature and purpose of the abortion procedure, the risks and the alternatives, and in order to make a free and uncoerced decision. The standard for informed consent is what a woman wants to know, not what an abortion provider wants to tell her. Procedures performed at the cost of robbing women of the autonomy of decision-making. It is imperative that the woman know the name of the physician performing the abortion, the risks, the gestational age of the unborn child, because her risks increase as the gestational age of the child increases. And she also needs to know the medical risks associated with abortion and carrying the child to term. The bill also requires that women be informed of certain things 24 hours so that they are not coerced and pressured into the abortion decision. These elements are critically important as many women feel pressured and coerced, and I urge you to vote favorably on this bill. Thank you.
Thank you, Ms. Harrison, for your testimony today. The next witness is Olivia Summers.
Thank you. My testimony today in support of HB 1317 is both in my capacity as Associate Counsel with the American Center for Law and Justice and in my private role as a volunteer co-leader of small groups that facilitate healing for women with post-abortion trauma. You have my full written testimony concerning the constitutional validity of HB 1317. In these few minutes, I would like to add a couple things to highlight the importance of the Women's Right to Know Act. No matter how much the abortion advocates try to downplay the reality of abortion, it is the purposeful killing of an innocent human being. And the trauma that women experience after an abortion is both real and devastating. I know many women who deeply regret their abortion and who have experienced a diversity of negative side effects from abortion. Not one woman I have talked to believes that she was over-informed about abortion and its consequences. These women and their stories illustrate the reason why the Women's Right to Know Act is necessary. Misinformation about abortion and its effects is rampant in American culture. Women are told that abortion is extremely safe and that it is like any other medical procedure. However, abortion has even been compared to going to the dentist. The Supreme Court, however, rightly pointed out that abortion is inherently different from the other medical procedures because no other procedure involves the purposeful termination of a potential life. This is one reason why the Supreme Court has upheld informed consent laws concerning abortion. Abortion can cause physical harm to the woman, resulting directly from the procedure itself, from deprivation of the health benefits of continuing pregnancy, or by other means. Moreover, abortion can cause deep emotional anguish and sorrow, and there is no undoing abortion. It is an act intended to permanently end the life of an unborn child. Abortion should not be a woman's only option because she is uninformed of all other options available to her. For these reasons, the ACLJ strongly supports HB 1317 and the facts, information, and choices it makes available to women. Thank you.
Thank you. The next witness is John Roswell.
Good afternoon. Are you hearing me?
Yes, sir.
Okay, you weren't earlier. This is John Roswell. I have stood in front of Planned Parenthood for about 5 years now, offering alternatives to abortion to women. And from that experience, I know that women are not being properly informed as to what actually will take place during an abortion. The sonogram results are hidden from them. They are lied to as the actual development of the child that is to be aborted. I have had women tell me that prior to the abortion, they were not fully aware of what was going to actually happen. And then after the realization of what had occurred after the abortion, they have grieved for years afterwards, describing to me how the sound of the abortionist vacuum, and even worse, the sound of the baby's remains plopping into the catch basin, resonates in their head as if it was just happened, even though they're talking many years later. There's also the fact that when a woman is unsure of what she wants to do, Planned Parenthood uses mind control techniques, such as putting the mispriston pill on her hand and then telling her if she doesn't take it right away, it will melt. The fact that next door to Planned Parenthood, the organization that's called Options at 328 has given women, or has had 20 women in the past month of January request a pill reversal, shows that the Planned Parenthood, and I'm sure other places, are putting pressure on women rather than giving them informed consent. Please recommend the passage of this bill. And I want to mention one other quick thing. Laura Bogley lost her father yesterday, a former lieutenant governor of this state. I think we all owe her an opportunity to say to her that we want to offer our condolences, and we respect the fact that in this time of grief, she has thought it was important enough to come here and speak. Thank you.
Thank you, Mr. Roswell. The next witness that we'll have is Deborah Bracata.
Good afternoon. I'm Deborah Braccato, and I'm a mother of 4 daughters, a nurse, and a volunteer who's worked with many women facing a crisis pregnancy. I also represent Hartford County Respect Life coordinators. An abortion is an invasive medical procedure, and women deserve the same informed consent that would be required for any other medical procedure. Women deserve a comprehensive explanation of their current physical condition, what will happen to their body during the procedure, risks and complications of the procedure, and what to do if any of those risks and complications occur. Working at a crisis pregnancy center in Baltimore County for 8 years, I assisted young women from Baltimore City and Baltimore County. Many of those young women came for support for a current pregnancy after experiencing an abortion for a prior pregnancy. For most, it was an in and out, same day procedure, no preoperative blood work, no waiting period. Sometimes the women were given a sonogram to determine the gestational age of the baby, but they were not shown the image or given an explanation of the image. The young women would say, "I can't do that again," and I didn't know. They did not understand what was involved and were not prepared for the physical and mental aftermath. They felt rushed to, quote unquote, get it done and assured they'd be better off. The abortion centers did not respect their right to know, and these women were not given information to compare the risks of abortion versus the risks of pregnancy or the facts about carrying a child to term and where to get help. Abortion isn't a permanent action for a temporary condition. And I want to add that all of these women that I saw that spoke this way were Black women. So I feel that the abortion industry is preying upon not only these Black women, but poor women in general, because they're so afraid that they will not have the support they need to carry their child to term. So please think about the young women in your lives and what you would want for them. I urge you to respect and protect a woman's right to informed consent and sufficient time to consider options. And please vote in favor of House Bill 1317. Thank you.
Thank you, Ms. Bricata. Those are all of our favorable witnesses. Right before I move to asking any questions from our committee, I would like to say to Ms. Bogley, family of HGO certainly wishes, condolences for your family, and thank you for your father's service to the state of Maryland.
Thank you, Madam Speaker Pro Tem. I appreciate it.
You're welcome. At this time, are there any questions from our committee? Not seeing any, I would like to then move to the unfavorable witnesses. The first witness we'll hear from is Robin Elliott.
Good afternoon, Robin Elliott. I am here today on behalf of Planned Parenthood of Maryland and appreciate the time to speak with the committee about this bill. Planned Parenthood of Maryland is a healthcare provider, and like all other healthcare providers, Maryland law already provides that each healthcare provider must use informed consent for any type of healthcare service. In this bill, the informed consent is about misinformation. In the bill, it is listed the risk of abortion care. These risks have not been proven. In fact, they've been disproven by the clinical evidence, risks such as breast cancer and long-term mental health effects. What is extremely concerning about the bill is really the provision about the waiting period. What the bill requires is that the provider must show the patient on the Department of Health's website this informed consent form, and then the patient has to wait 24 hours. If that's not able to happen, then the provider has to mail the patient using certified mail and wait 72 hours. This waiting period is really a disservice to individuals who do not have access to computers, who live far away, and does not provide for any additional medical quality for services. And lastly, this bill has substantial penalties for physicians who do not follow these rules. And there are no other such penalties anywhere in our code about physicians and these types of provisions. So this bill is singling out abortion providers differently than any other healthcare provider. And for that reason, we would ask for an unfavorable report.
Thank you, Ms. Elliott. Are there any questions from the committee, as she is our only unfavorable witness on this bill? Not seeing any, this concludes the hearing for House Bill 1317. Thank you, Delegate Rose.
Thank you.
You're welcome. The next bill that we have before us is House Bill 1321. It is sponsored by Delegate Ericon. She is unable to be with us on today.
I'm here.
Oh, I just got a message that you weren't. Okay, thank you. You may proceed with 5 minutes on this bill.
Thank you, Madam Chair. I apologize if there's background noise. I'm at the hospital awaiting my daughter to come out of surgery. She's doing great. This bill, HB 1321, is a reporting bill specifically about babies with gastroesthesis. Gastroesthesis is when the baby's intestines form on the outside of the body. It's very apparent as young as up to 8 weeks that the baby has this birth defect. And because we don't tabulate how many babies have this defect through and are terminated through abortion, we really have trouble getting funding and focusing research on what are the causes. The causes that we believe are behind this is a combination of genetics and environmental factors. Some research has shown that it could be atrazine, which is a pesticide that's commonly used on crop farms. When my baby had it, we did have our water tested and we did have high atrazine levels in the water. So we would love to have answers to some of the questions, and with a lack of tabulating of how many babies actually have this defect, it can become really difficult. So this is a simple reporting requirement, which would say, they automatically, after an abortion, put the baby back together because they need to make sure that no parts of the baby are retained inside of the mother. So they can easily see that this defect has occurred. And in fact, when I delivered my baby full term, he was stillborn. But the nurse that cared for me when I delivered him did work at an abortion clinic in her other job, and said she did see babies every day that had this defect. So I will not take up the full 5 minutes of my time. I just hope that you guys will consider this bill. It should not have any impact on abortion broadly. It would just be a reporting requirement to let the state know how many babies are actually developing this disorder, so that we can try and get research and funding around what's causing it and mitigate some of those risks. Thank you so much, Madam Chair.
You're welcome. And thank you, Delegate. We certainly pray that your daughter will be coming through surgery successfully. Would you like to yield any of your time to your only witness on your panel?
Sure, absolutely.
Mr. New. We will hear now from Mr. New, and you do have the remainder of the delegate's time.
All right, I do want to kind of echo what Laura Bogley said earlier, that I was under the impression I was only speaking on 2 bills today. So I'm going to be kind of winging this to some extent, but I just think that improving the requirements of abortion reporting in Maryland, I think, is just a good idea in general. I think Maryland, to be perfectly honest, is one of the worst states when it comes to abortion reporting. They are only one of 3 states that routinely does not report any data to the CDC, California and New Hampshire, the other 2. We've not actually had Maryland report CDC abortion data since 2005. And I would just hope, I realize that abortion is a very contentious issue, and I realize finding common ground is not easy, but I'd hope on something like this we could find some common ground. I think the good data just benefits everybody. It would be useful, broadly speaking, in terms of evaluating things like the impact of sex education programs, contraception programs, various kinds of pro-life laws. Again, I just think our reporting requirements, broadly speaking, could be improved. So thank you.
Thank you, Mr. New, for your flexibility as well. At this time, are there any questions from the committee for the bill's sponsor and Mr. New? Okay. Not seeing any, this concludes the hearing for House Bill 1321. Thank you, Delegate, for your bill, and we certainly are with you. The next bill we'll hear will be House Bill 1139, sponsored by Delegate Adams.
Thank you, Madam Chair and committee members. For the record, Delegate Chris Adams here to present House Bill 1139 related to public funds and prohibition for expenses related to abortions. First off, let me just say that I've been proud to support leadership in the House Republican caucus for a number of years who have brought bills, set the tone for legislation and policy. So I've never brought a bill like this to the committee members. This year, especially this fall, when we had the realization that today's bills, the 2 bills that we heard today, were going to come forward, I felt it was important that I speak, not necessarily on the House floor, but speak in the way that us legislators have the strongest voice, which is to bring legislation forward that matters. And so that's why I'm here today on this particular subject matter. Before I was elected in 2014, I had the good fortune of attending a Maryland Right to Life conference. A dear friend who's no longer with us, Cookie Harris, sat down with me as a candidate at the time, and I'm a conscientious objector to abortions. I was that long before politics, and I asked her, how does someone like me, if I get elected, become effective on these subjects? And her comment to me was, well, in Maryland, it's tough, but don't allow taxpayer funding of abortions. That's where you can speak, and that you'll find more people in support of that position. And as you're defending your district, Mr. Adams, those are the places where more broad support can be found. And so that's why I'm here today, and thanking Laura Bogley for working with me to find the right voice for this particular issue in a respectful way, which is my intention. So with that, Why am I introducing this bill? The purpose of the bill is to further state policy that normal childbirth is to be given preference, encouragement, and support by law, and through state action, and affirmed as serving the best interests and common good of Maryland citizens. This bill is intended to ensure that public funds are not used to subsidize abortions directly or indirectly. So what does the bill do? The bill prohibits the use of public funds for abortions or services related to abortions. Unless states expressly prohibit abortion providers from obtaining public funds and resources, they may acquire taxpayer-funded grants and assets and use them to bankroll or subsidize their abortion business. And so why do I believe it's important to pass now? Well, aside from the fact that I think we've asked some very difficult questions on the House floor today and put difficult conversations in front of our voters this fall, the conflict with so many people in Maryland. It's important to pass now because 81% of people polled believe that public funds should be prioritized to fund programs that promote the life and health of both women and children. However, Maryland taxpayers are forced to fund nearly 10,000 elective abortions each year through Maryland Medicaid and many more millions through state departmental contracts and grants. This bill will protect the moral, religious, and ethical objections of Maryland taxpayers like myself to fund elective abortions. So Madam Chair and committee members, thank you for the opportunity to speak on this issue and show you where my personal positions on this are. And God bless Maryland Right to Life on this particular fight on this very difficult day. Thank you very much.
Thank you, Delegate Adams. The next witness we'll hear from will be Vince McAvoy.
Thank you so much, committee, and thank you, Delegate Adams, for bringing this bill. I appreciate what you said as far as making a statement. This is one of the things that unfortunately we have seen year after year in Annapolis, and that we even saw today on the House floor, and even today in the way that these bill hearings are being handled. I'm having to cut and paste from my previous testimony to get to this, and it detracts from what I can deliver, and I'm going to do my best. And I first want to echo exactly what you said about your moral and religious objections, and that all Marylanders have to funding what we view as abortion as a murder, and that it shouldn't be inflicted upon us. And yet here we are, because a happenstance of being born in the state. So you standing up against this is very important, and you speak for many people who have unfortunately been silenced. And I'm going to tell you, in my personal circle right now, this week, I've been having some issues, and I'm not going to go into them, but I'm just saying that is the level that this state tries to tamp down and silence people who don't go full bore into celebrating what we feel is death, what we feel is murder. So when we hear that this bill would help stop the funding of the state and federal government for promoting abortions, for funding abortions, for advertising these things, this is a very much needed issue. Put it against the backdrop of, I drew this up earlier, of HB 626. Yours gets into basically the issue of cloning and all manner of things that are coming about in science and technology now, where we're going into broad new areas, and these bills are allowing just unfathomable exploration and rights, and as a right, and they're not rights. I appreciate this bill. I thank you for bringing it and strengthening this matter. Grateful to you, committee, for listening.
Thank you, Mr. McAvoy. The next witness is Francis Arlingas.
Thank you, Madam Speaker Pro Tem. My name is Dr. Frank Arlinghouse. I'm from Ellicott City, Maryland. Fundamentally, this bill is about not subsidizing abortion and related activities. This is consistent with public opinion. A new Marist poll shows a 12-point advantage for opposing taxpayer funding of abortion. This includes 53% of independent voters. The state should express a clear preference for birth. It shouldn't be spending on abortion in schools. It shouldn't be spending on human cloning, and it shouldn't be spending on human research that involves the death of the subject. For example, embryonic research that involves destroying the embryos. There is a particular section to prevent misuse of trust funds for abortion advocacy. Being on my father's trust, I think this is exactly the sort of thing that sometimes gets overlooked and we should pay attention to. It also takes a position that public funds should be devoted to other non-abortion related activities. Fundamentally, what this is about is getting the state and state funds out of the abortion business, and it keeps the state out. On a personal note, I want to express my sympathy to my friend Laura Bogley, and also I'm joined in this testimony, Delegate Adams, by my wife and 3 daughters, one of whom currently holds the Cookie Harris Scholarship at Mount DeSales in Catonsville. I thank the committee for their attention, and I urge you to return a favorable report on House Bill 1139.
Thank you, Mr. Arlingas. Thank you for being here and testifying on today. The next witness is Laura Bogley.
Laura Bogley again for Maryland Right to Life. Thank you, committee. I want to thank Delegate Adams for introducing this important bill to protect taxpayers from being forced to fund abortion, which is a government infringement on our rights of conscience, free speech, and free exercise of religion. Women don't want abortion. In fact, 74% of women say they did not choose their abortion, but felt coerced into abortion. So it's the proper role of this state to prioritize public funding for life-saving alternatives to abortion that really empower women to choose life and to decide for their own families. And 81% of people polled agree that they want, whether pro-choice or pro-life, agree that they want government funds to support programs that support the lives of both mothers and children, and that we don't have to choose. So because we delegated testimony today because of the time restrictions, I just want to share with you a couple of other notes on funding of abortion in Maryland. Legislators have a huge misunderstanding about this. State legislators are allowed to restrict abortion funding in Maryland. The Supreme Court has held that while the constitutional right to privacy, there is a constitutional right to privacy, there is no constitutional right to abortion funding. That was Harris v. McRae all the way back in 1980. But as speakers have said, Maryland is forcing us to do that, one of 4 states. 58% of people in the January 2021 Marist poll, as Frank alluded to, oppose taxpayer funding for abortion. Each year, the governor provides abortion funding in the state operating budget. And we see that because we don't have a Hyde-style amendment to exclude taxpayer funding of abortions. So any legislation that addresses healthcare or pregnancy will likely cover abortion services unless lawmakers specifically exclude abortion through amendments. So we know we're paying over $10 million or $6.5 million for 10,000 abortions through Medicaid, but there's also pass-through funding, millions of dollars of more through Department of Health and Department of Education. And so we ask to prioritize that public funds for life, and that's why we support this bill, and we thank Delegate Adams. Thank you.
Thank you. The next witness we have is Michael New.
Thank you, Michael New, testifying as concerned citizen. I reside in Hyattsville, Maryland. I'm in favor of this bill for the simple reason that once you start paying for abortion with taxpayer dollars, abortion rates go up. I'm a professor. I teach economics to our business students at Catholic University of America. I'm very familiar with the academic research on this. I've done research myself on this. It's published in academic journals. Pro-life, pro-choice, every credible piece of research I've seen shows that when you start paying for abortion with taxpayer dollars, abortion rates go up. We had Maryland in 2022, according to the Department of Legislative Services, $6.5 million was spent to abort 9,864 children. Again, we also see abortion funded indirectly through family planning programs and other programs. I think we need to get the state out of the business of funding abortion. Also, limits on taxpayer funding of abortion enjoy very broad public support. I've seen 12 polls on this issue since 2016. 11 of the 12 majority oppose taxpayer funding of abortion, and all 12 a plurality oppose taxpayer funding of abortion. So people really do not want their taxpayer dollars paying for elective abortion. The third thing I'll say is that this is really an issue that the legislature has not really directly engaged. Maryland liberalized their abortion law back in 1968. There was really never a formal vote to start using taxpayer dollars to fund abortion through Medicaid. The state Medicaid office just started reimbursing for abortions, and the process and the practice just never stopped. So I really think this is an issue where there needs to be, a full debate where people should be allowed to express their point of view. I really don't think that has happened. And the last thing I'll say is that I think it's important to protect the conscience rights of taxpayers. I've lived in Hyattsville since 2018. I'm disappointed my tax dollars fund abortion. There's 69 organizations in the state that provide help to pregnant women. There's a safe haven law. There's no reason why my tax dollars or anybody else's tax dollars should have to pay for abortion. Again, I recommend a positive report from this bill. Thank you.
Thank you, Mr. New. Those are all of our favorable witnesses. Are there any questions from the committee for Delegate Adams and the favorable panel? I see Delegate Shaliga's hand.
Thank you, Chair Sample Hughes. This is for Delegate Chris Adams. You are speaking of Cookie Harris, Andy Harris's wife.
Yes, the first time I met her in person was at a Maryland Right to Life conference, and a wonderful lady, and we all miss her dearly.
Well, you've warmed my heart today by bringing her name here, and what an honor for her. She was an amazing lady and champion in the pro-life movement. So thanks for mentioning her name today.
Yes.
Are there any other questions from the committee for the favorable panel? Not seeing any, I'd like to move to the one unfavorable witness, Robin Elliott.
Good afternoon, Robin Elliott here today on behalf of Planned Parenthood of Maryland in opposition to House Bill 1139. The bill's provisions are very broad. They would eliminate abortion coverage to over 2 million Marylanders. That includes all people covered under Medicaid, the state employee and retirees health plan, as well as the Maryland Health Benefit Exchange. Just some background, 16 states provide a broad range of coverage of abortion care through Medicaid. And Maryland's Medicaid program started covering abortion care in 1979 because the Maryland General Assembly adopted language in its budget bill, and that same language you still have today. One of the items I wanted to highlight in this bill that is so problematic is it says that the state may not contract in any way with a provider that provides abortion care. This means that almost any hospital, any abortion care provider, or any private practice that provides abortion care could not participate in the Medicaid program or the state employees program or in the health benefit exchange. What this means is very few healthcare practitioners could continue to provide abortion care. So ultimately, this bill would result in the marginalization of abortion care in Maryland. And for that, we would ask for an unfavorable report. Thank you.
Thank you, Ms. Elliott. Are there any questions from the committee at this time for the unfavorable witness? Not seeing any. Thank you, Delegate Adams, for your bill. This concludes the hearing for House Bill 1139. The next bill we have before us is House Bill 735, Delegate Metzger.
Good afternoon, Madam Chair.
Good afternoon. Welcome to the committee.
What a joy it is to be here. House Bill 735. I simply start off today by saying that this is the day that the Lord hath made, and I will rejoice and be glad. I can rejoice today because I get the opportunity to share with you this wonderful abortion fetal heart bill 735. And I say that today because this is the second or third time that I have presented this bill. And let me say today, ladies and gentlemen, I need you to clearly listen to your heart. The Declaration of Independence states that we hold these truths to be self-evident, that all men are created equal, that they are endowed by their creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. Think about that. This week, the House of Delegates voted to enshrine into our state constitution that this bill is now before the Senate. And if this bill passes in the Senate, the voters will decide this issue on the November ballot, which will allow abortion on demand up to the final days of a woman's pregnancy. Now, the people have become their lords. The fetal heartbeat bill has become a key medical predictor in the unborn child, which will reach live birth. To make an informed choice about whether to continue her pregnancy. The pregnancy woman has a compelling interest in knowing that the likelihood of her unborn child to full-born birth will, in the presence of a cardiac activity, viability outside the womb. If a pregnancy presents a clear immediate threat to the life of the mother, a medical professional shall use all means to exhaust all medical resources to save the life of the mother and the zygote, embryo, or fetus. The medical professional may not be subject to prosecution under this law, and if the medical professionals provide documentation of his efforts or her efforts. Rape or incest should not require the mother to carry the pregnancy to full term. Life begins in the moment of conception. Ladies and gentlemen, make no mistake about it. Look at the sonograms. Let them hear the heartbeat of that child, because an adoption is a better choice. The zygote, the embryo, or the fetus is a human being. The enactment of the state law protecting the right of life and all human being is the constitutional responsibility of the legislative branch, not the judicial branch. And again, I speak for those that cannot speak for themselves. And again, I look at you and say, listen to your heart. I respectfully request the favorable report on House Bill 735, and thank you for your time and your consideration. And I will allow the extra time to go to the people that are proponents. Thank you.
Thank you, Delegate. You've energized me with your tone, and so good to have you here at this moment. The witness that we have before us is Vince McAvoy.
Thank you so much.
Do you need the remainder of his time?
Yeah, I'd like to use that time, sure.
Okay.
Grateful, thank you.
Thank you.
I appreciate you. Thank you, Delegate Metzger, for bringing the bill. I've drawn this up for you because it's kind of a best in class that you have. One of the things that I really want to encourage about people or who are reading, who are listening to these, is to read the care that's put into these bills. There is a huge amount of all the people who are against these. They're listening. They're on the House floor and they're listening, and they're hearing all the different cases. And we know that there's a tenet that you don't get good law off of one-offs or one-time situations, but that doesn't mean that they're not listening, and they fold these things where relevant into the code. Now, if you look at what I put on Delegate Metzger's bill, the 2217, I think that's a little superfluous. It sort of gets into the weeds of the court issues, but so many other pieces that Delegate Metzger is bringing this year and has brought in several other years are point on, and they cover the gamut. Of course, like he said, the definition of life. I value him, and I value his boldness on this matter, that he's stating that overtly, that he goes into so many other options that could go along the path where people might have a concern in the state of Maryland, maybe not other states, but in the state of Maryland, with respect to the health issues of the mother and the child. I want to focus on this bill is 18 pages long. So like I said, there's a lot of stuff put in here. That it does have allowance for I'm on page 10 now, that that there are Supreme Court issues pending. And it gives some answer to that, the direction on this. So I would direct our anti-abortion proponents to take a look at this bill, see the care that's put into it. You see that it references also the Planned Parenthood versus Casey issue, where this is speaking to affirmative defense. There's another bill that's in, which is speaking to how there was psychological trauma there, and that should have been included in the consent and the direction that the particular lady who got an abortion in that case mentioned. And then the last part that I want to say is the form, because I want to see more of these in our legislation. These forms are so helpful with short-circuiting all of the various possible legal maneuvers that could happen on these cases. So if everyone turns to page 15, it goes over the consent issues that come with the sonogram. I think this is very important.
Thank you,
My
Mr.
time's up.
McAvoy.
Thank you so much, committee, for listening.
You're welcome. The next witness is Francis Alingas.
Thank you. My name is Dr. Frank Arlinghouse. I'm from Ellicott City, Maryland. And I want to thank Delegate Metzger for proposing this bill. It uses a scientific standard to set a new basis for when an abortion should not be performed. A heartbeat detected in utero is quickly followed by organ formation, blood, circulations, lungs, fingers, toes. But even before this, a genetic blueprint was determined at conception. The scientific markers are present and human life in the womb should be protected. The state has a compelling interest during pregnancy to protect the health of the woman and the life of the unborn child. Other sections protect women from coercion, provide informed consent, including references to economic resources. Additional informed consent requirements, including a sonogram requirement. These provide women protection from coercion, from undue influence, and also provide her information on the life within her. Heartbeat and major scientific markers of human life are present. And this is a human life that is going to be growing to maturity over the next 20 years. But the heartbeat is a good scientific standard to use as a dividing line. I'd like to point out that it's detectable very early via transvaginal ultrasound. More normally, it's detected at 6 weeks using an early ultrasound. And it's very common these days for people to purchase a home fetal Doppler kit. It's normal for parents to be able to hear their baby's heartbeat at visits as early as 12 weeks. Oh, sorry, even in the home. This is another bill that has penalties for the doctor, not the woman. I urge you to return a favorable report on this important legislation. Thank you.
Thank you. The next witness we'll hear from is Tom Henry.
Thank you, Madam Chair. Thank you, committee, for hearing me and testifying in favor of House Bill 735. And thank you, Delegate Metzger, for submitting this. You know, it's not hyperbole to state that other than the soul, the heartbeat is the foundation of all support of life, liberty, and the pursuit of happiness. Now, my faith elicits my support of the legislation, but the tenets set forth in the original Roe versus Wade decision clearly demonstrate the need for this legislation. The trimester framework of Roe decision is no longer valid by advances in science, with preborns able to survive outside the womb in as little as 20 weeks, now shown to be an error in favor of viability. Now, the fetal heartbeat is known to be detected in as little as 6 weeks. The argument that the mother may not be aware she's pregnant is just a canard that does not justify a termination. Norma Covey, the Jane Roe behind Roe versus Wade, made a deathbed confession in 2017, saying she switched her support to the anti-abortion movement because she was paid to do so. She publicly lied about being raped and apologized for making a false rape claim. And in the mid-90s, she switched her support, becoming a face of the pro-life movement. That decision also violated science. We've been told for the last 2 years to follow the science, not the political science or the science fiction established by that bad ruling. This also mimics the heartbeat bill in Texas, and it's been reported there's been a 60% reduction of abortion since it passed. Your parents thought that life matters, and if you have children, you believe life matters too. Other bills in this legislature is trying to allow post-birth abortion as well. The agenda is clear. Would any of us who have children look them in the eye and tell them that they do not matter? My birth parents thought I was valuable, putting me up for adoption. I cannot look in my own children or my grandson's eye and say they don't matter. We should follow the science, not the political science. Consequences of the passage of these onerous bills will only exacerbate the already declining value of human lives. Thank you for your time, and I'll answer any questions you may have. Thank you.
Thank you. The next witness is Laura Bogley.
Madam Speaker Pro Tem,
Yes, ma'am.
I submitted only written for this bill. Thank you. Written support.
You're on my list for both. All right. Well, I will now ask the committee if there are any questions for the favorable panel. Not seeing any, then I'm going to move to the unfavorable witness, Robin Elliott.
Good afternoon, Robin Elliott here on behalf of Planned Parenthood of Maryland. Wanted to start by saying that the bill in front of you is the bill that passed in Texas and that has now effectively eliminated abortion in Texas. What the bill does is at 6 weeks, and the appropriate terminology would be cardiac activity. There is actually not a heartbeat at 6 weeks, but at 6 weeks, this would
Miss Elliott froze. Okay, we'll just give her a couple seconds to see if she's going to become unfrozen. Okay, so with that being where we are, she is the last witness on the unfavorable panel. And she has been kicked out. Okay. Any questions for the bill sponsor? Okay. There being none, then this concludes the hearing for House Bill 735.
Thank you.
Oh, you're welcome, Delegate. The next bill we will hear will be House Bill 1167, Delegate McComas.
Thank you. Thank you, Madam Chair.
You're welcome, Delegate. You have 5 minutes.
Okay, just a second here. Let me get my testimony. This is Delegate McComas in support of HB 1167, Public Health Abortions Coercion, Coercive Abuse Against Mothers Prevention Act. HB 1167 prohibits a person from committing or threatening to commit coercive acts with the intent of leveraging a pregnant woman to have an abortion. It also provides that a pregnant minor is to be considered emancipated for purposes of being eligible for public assistance in situations where they are without support from parents and or guardians due to their refusal to voluntarily seek an abortion. The bill further provides facilities that perform abortions must post certain signage in certain rooms of the facility that are meant to re-inform the pregnant woman that they have choices and outreach programs available to them. Abortion is often anything but a choice. Using coercive control, women are often subjugated to the desires of others, including partners, parents, friends, or employers. The Daily Beast has acknowledged that coerced abortions are a twisted form of domestic abuse, occurring more often than previously thought. Coercive abuse can take many forms and is intended to force a woman into choosing an abortion. Untold numbers of women have suffered, including, by example, Caitlin Clamp, a 19-year-old college student and former high school honor student, was bound and gagged by her parents who disapproved of the child's father and forced her into a car to make a trip from Maine to New York, where they knew someone who would perform an abortion. Fortunately, Caitlin managed to escape when she convinced her parents to let her use the restroom in a store. Police later found a .22 caliber rifle, rope, duct tape in the car. There was two. Shauna Alexander, an assistant women's basketball coach at the University of California at Berkeley, was told by her boss, Mariana Stanley, that she needed to have an abortion in order to keep her job. When Alexander refused, Stanley demanded her resignation. 3, a 16-year-old Cleveland girl was beaten with a metal broomstick by her father, who wanted her to get an abortion. 4, a 16-year-old Georgia girl was forced by her mother and 2 cousins to drink turpentine in order to induce an abortion. 5, there was Chantrice Otre was told by emergency shelters in Richmond, Virginia, that she would not be eligible for a room because she was pregnant. A staff member then drove her to the bank to withdraw money for an abortion and took her to the abortion clinic. Clearly, many women who arrive on the doorstep of an abortion clinic are not there of their own free choice. Instead, they are there because others are pressuring or forcing them to undergo the procedure. Hundreds of women have testified to the devastating effects of their coerced abortions. At least 18 states currently have some form of coercive abuse prevention law. Arizona, Delaware, Idaho, Kansas, Louisiana, Michigan, Minnesota, Missouri, Montana, Nebraska, North Dakota, Ohio, Oklahoma, South Dakota, Tennessee, Texas, Utah, and Wisconsin. Research indicates that violence against pregnant women is a serious problem. Many women report that they were coerced into abortions and have suffered grievous physical, emotional, psychological, and spiritual harm as a result. Reproductive health care facilities are often the only and last opportunities of hope for victims of coercive abuse, and as such are in a unique position to help these women. More cases of coerced and attempted coerced abortions are reported if women are informed of their rights and given information concerning treatment and protection options. More women receive treatment for coercive abuse if they are informed of their rights and given information concerning treatment and protection options. Coercive abuse is a serious women's health issue because it violates a woman's right to physical and emotional health, freedom of conscience, and to freely choose either to continue her pregnancy or to have an abortion. HB 1167 provides for the prohibition of actions intended to coerce or otherwise force a woman to abort her unborn child. More importantly, it empowers all mothers in the state of Maryland to exercise their freedom of choice in choosing life for their unborn child free from violent and abusive coercion. Please pass HB 1167. Thank you.
Thank you, Delegate McComas. The first witness we'll hear from is Deborah Bricado.
Hello again to everyone, and thank you, Delegate McComas, for this bill. As I've said before, I'm from Harford County, and I worked for 8 years in a crisis pregnancy center in Baltimore County that served a majority of clients from Baltimore City. Some of those young women came looking for support for a current pregnancy after experiencing abortion for a prior pregnancy. These women would say, "I can't kill another baby," and would share how they were pressured into the abortion by the fathers, or in some cases, family members. There was no one offering support for anything other than an abortion. At the time, these girls were unaware of the services of crisis pregnancy centers. In another case, I was praying across the street from the Planned Parenthood on Howard Street in Baltimore City. I spoke with a group that was headed to the abortion center. It was a 15-year-old girl with tears streaming down her face, her aunt, her grandmother, and her uncle. The women stated that the girl must get the abortion, that the father was not going to help, and that she was too young to take care of the baby. I provided information about crisis pregnancy centers. The women stood just in front of the crying girl and said they had made their decision. The uncle said nothing, and the girl continued to cry. They all went in, and an hour later, when I left, I had not seen any of them exit prior to me leaving. These women were all Black women that I'm talking about who felt forced into their abortion. In these cases, it's clear the young women are not given a choice. They're prevented from seeking alternate solutions. They're coerced into taking a permanent action for a temporary condition, which can cause physical, emotional, and psychological damage. In each of these cases, the young women go into the abortion center and receive the abortion during that visit. If there is a consultation, there's not adequate time to think about a decision that cannot be reversed. when making material purchase, we get that opportunity. And if we're concerned about racial abuse, we really do need to consider the abuse against Black women who are being forced into these abortions. I encourage you to vote in favor of House Bill 1167. Thank you, Delegate McComas.
Thank you. Next witness is John Roswell. Is Mr. Roswell still with us? Oh, sir, you're muted.
Hello, can you hear me?
Yes, sir.
Okay, this is John Roswell. I'm from Howard County. Please do not think that the abortion industry cares about its clients, because it is an abusive and coercive business. I've stood in front of Planned Parenthood in Baltimore on Howard Street for almost 5 years while offering women alternatives to abortion, and constantly see abuse and coercion. Frequently, obviously, abusive men bring women there that they are pressuring to have an abortion. And I've even seen a man slam a woman's head into a building window before marching her inside. And the Planned Parenthood and the security guard did nothing about it. I know of parents and grandparents telling a young woman that they have brought there that if she doesn't have an abortion, she cannot come home. I see women crying before they go into the Planned Parenthood, and no one inside apparently cares. And these women come out crying after the abortion and will probably cry for the rest of their life. As an example, a woman on her 60th birthday one day stopped on the sidewalk to tell me her history. At the age of 15, and as a totally innocent virgin, she had been raped at gunpoint by a total stranger. And when that had resulted in a pregnancy, her parents forced her to have an abortion at Planned Parenthood. But now, 45 years later, she told me she still cries about the loss of that child. If a woman who's raped cries, what about the ones that aren't? Other women have told me how the emotional distress to follow an abortion caused a downward cycle in which they resorted to drugs and alcohol to try to quell their sense of grief and guilt. I know that if a woman inside Planned Parenthood is wavering as to whether or not she wants an abortion, pressure will be placed on her, even to the point of mind control techniques, such as putting the mispriston pill on the client's hand and telling her she must take it right away before it melts in her hand. This may be why the building next door, where options at 328 exists, had 20 requests during the previous month of January for a pill reversal. Abortion is an immediate effect on 2 lives that harms the mother and multi-human life. Thank you.
Thank you. Next witness is Laura Bogley.
Thank you again. Laura Bogley, Maryland, Right to Life. We want to thank Delegate McComas for bringing this bill, which is critically important to protect the health and welfare of pregnant women and girls who are often deprived their rights to choose life for their own children, and who are far too often become victims of abusive partners and even sexual traffickers. This bill in no way infringes on a woman's right to abortion, nor does it prohibit abortion in the case of rape or incest if the woman chooses for herself and is not coerced by her rapist to cover up his crimes. This bill protects women's rights and will empower more women to choose life for their children. This bill is particularly important in Maryland, where women and girls are being trafficked across state lines to evade abortion restrictions in their own states, including parental consent laws. There is substantial and developing evidence that many family planning and abortion clinics are not reporting all instances of suspected abuse and are in some cases even advising abusers how to circumvent laws. Jeffrey Epstein is a prime example of this. He was a sexual predator who used abortion coercion as a tool to continue raping young women and girls and to exploit them for his own money and power. Unfortunately, he is not an isolated incident. The bill solves that problem by strengthening protections for pregnant women and girls in the law. Finally, the bill helps law enforcement authorities to enforce existing law and further protect women from abusive partners and sexual predators. We urge you to protect women, not predators, and to pass this important bill. Thank you.
Thank you. That is all of our favorable witnesses. Now I'd like to move to any questions from the committee for the bill sponsor or the favorable witnesses. Not seeing any questions from the committee, I will now move to the unfavorable witnesses. The first one being Mr. Vince McAvoy.
Thank you so much. I appreciate it, committee. Delegate McComas, I am very soft on this subjection. I'll tell you where I was coming from with this. I didn't think you'd have receipts, but you brought receipts. And so I'm still looking at 20-218. I'd like to see page 3 tightened up, but I want to say that I see employment is here. I know that somebody's going to give you a hard time with that, but I think I'm going to remove my objection on this. I hope I could see this being cleaned up in committee. So I'm going to remove my objection. Thank you. That's all.
Thank you. Okay. Thank you. The last unfavorable witness we have is Laura Ruth.
Good afternoon, Madam Chairwoman, members of the committee. My name is Lori Ruth. I'm the legal director at the Women's Law Center of Maryland. We advocate for laws that assist women and protect their bodily autonomy. We are strongly opposed to HB 1167. Reproductive coercion is defined as behavior that interferes with the autonomous decision-making of a woman with regards to reproductive health. Specifically, this may take the form of birth control sabotage, such as removing a condom, damaging a condom, removing contraceptive patch, or throwing away oral contraceptives, coercion or pressure to get pregnant, and controlling the outcome of a pregnancy. In the work that we do, we represent and work with survivors of intimate partner violence. This bill singles out one form of reproductive coercion to the exclusion of all others, and it is the others that we most often see in our work. In fact, roughly 25% of women who report being physically or sexually abused by their intimate partners also report being pressured or forced to become pregnant. I also urge you to read the testimony of MCOS of the Maryland Coalition Against Sexual Assault, which has examples and statistics in this regard. Forcing a woman to have a child ties her to the abuser. Survivors of forced pregnancy or birth control sabotage need access to abortion care if they choose not to continue the pregnancy. Similarly, requirements to involve law enforcement should be a person's own choice. Factors of an individual wanting to inform law enforcement or be involved with them, personal to them, come into play, such as immigration status, whether they have a warrant outstanding, and whatnot. And so this too should be a decision by the person to decide whether to involve law enforcement. Instead of what this bill dictates, best practices, if it is revealed that the pregnant woman is being forced to abort, would be a warm referral for services to get them the help they need and to give them the full array of choices. The whereas clauses in this bill are interesting because they are couched in terms of choice, and that is what we are trying to protect today. This bill is an effort to subvert choice, and for those reasons, we oppose this bill. Thank you.
Thank you all for your testimony. The unfavorable witnesses. Are there any questions from our committee for the unfavorables? Okay, there being none, this concludes the hearing on House Bill 1167. We will now move to Delegate Cox. As a reminder, committee, the bills, the next 4 bills in particular are sponsored by Delegate Cox: HB 583, HB 1360, HB 1369, and HB 1364. Delegate Cox, I am combining your bills and would like for you to take your time to explain those bills, and you have 20 minutes to do so.
Thank you, Madam Vice Chair and members of the committee. I respectfully disagree with lumping more than single subjects together like this, and would lodge that in the record. And the singling out of my bills versus other bills, particularly when I believe Delegate Williams had multiple bills today in front of your committee, is discriminatory. And on that note, I would urge on the first bill, House Bill 583, abortions, prenatal diagnosis of Down syndrome, which is entitled the Down Syndrome Dignity Act, that this committee, honorable committee, move to protect our precious Down syndrome babies. This bill will ensure protection of Down syndrome babies from abortion solely on the fact that they have a chromosomal disorder. And according to this Center for Disease Control, which is found in about 6,000 babies in the United States, each year, or about 1 in every 700. After passage today of the abortion amendment on the House floor to the Maryland Constitution for an amendment purpose, granting abortion for any reason, this bill is the only way in Maryland, if you pass it, to protect Down syndrome babies. According to the health information website, What to Expect, the medical needs of Down syndrome babies vary. Some have more severe symptoms and may require more care and treatment than others. However, most Down syndrome people are able to live full and healthy lives. The Study Health website advises that in today's world, you can raise your child almost the same way that you would with a child without this genetic condition. Their physical and mental development may be somewhat slower, but they develop social skills at about the same rate as other kids. The best way to appreciate children and adults with Down syndrome is to understand who they are from a family raising a Down syndrome child. ForWantOfWonder.net is a website that highlights just such families. And before you vote on this bill, I ask you to please visit it and review it. Among the other awe-inspiring things about Down syndrome kids, they list famous Down syndrome adults, a sampling of which is Karen Gaffney, who has a PhD, is president of a not-for-profit and who swam the English Channel. And she also accomplished what only a few people in the entire world have ever accomplished, and that is swimming the full length, that's over 9 miles, of Lake Tahoe in the United States. Gerard O'Dwyer, a famous comedian in Australia, was awarded Best Male Actor in 2009 at the Tropfest, the world's largest short film festival. Sujit Desai graduated from high school with honors, and he went on to graduate from the Berkshire Hills Music Academy in Massachusetts after a 2-year residential post-secondary study in music and human services, and is an accomplished musician who has mastered 7 different musical instruments. And he's received numerous national and international awards. Isabella Springmul Tejada, at only 22 years old, is a famous fashion designer with her own label and has been voted one of the BBC's 100 women in 2016. And the list goes on and on. Had these parents not been willing to carry the pregnancies to term, or had the Down syndrome likely recommendations of doctors to terminate those pregnancies been followed, the world would be a less beautiful, a less inspiring place. Parents don't know what health, social, emotional problems the child will have as they are born and as they raise them. That's part of the challenge of parenthood for a multitude of reasons. But a few parents with Down syndrome have regrets over their wonderful child being part of their lives. But not just a few, no more than a few, and most of them do not. They certainly are some of the happiest people on the face of the earth. We all know this. We've seen that. We probably have interacted with Down syndrome individuals. And I want to leave you with this on this particular bill. By default, if you don't support this bill, you're part of a movement pushing the Down syndrome abortions on beautiful babies just because they're not perfect. Look in the mirror, or at least what society would say they're not perfect. I'd ask you to look in the mirror and ask if the person looking back is perfect. What if your flaws were identifiable with a prenatal test? Is your DNA perfect? Would you be here given your imperfect qualities? I request you return a favorable report on this important bill, HB 583, which protects Down syndrome babies from being targeted because of their genetic condition for abortion. And please stop treating the extra chromosomal human, the beautiful Down syndrome human, as a case for death. Thank you, committee. And I presume you want me to move right along, Madam Chair?
That would be correct. You're 1369.
So I have 1360 in front of me. I will switch that to 1369 as.
Oh, my apologies. It is 1360.
Okay.
Go right ahead. Thank you.
Thank you, Madam Chair and members of the committee. There's an urgent need for HB 1360. This bill is to ensure that the recent Food and Drug Administration protocols of distribution and use of mifepristone, originally referred to as RU-486, an abortion-inducing drug under the authority of 21 CFR 314.520, in a process that allows for post-marketing restrictions and provides accelerated approval for specified drugs that are shown to be effective, but can only be safely used through restrictions, that this practice is provided protections and care for women. The FDA does not treat these drugs in the same manner as drugs that undergo the typical approval process, giving them heightened scrutiny after approval. In September 2000, the FDA prescribed a specific gestation dosage and administration protocol for RU-486, and the protocol for this drug maintains that certain distribution restrictions are still necessary because of the drug's potential for serious complications. And that is according to the FDA. Sadly, many cases have existed and have happened and are continuing to happen where women are prescribed these drugs, are sent home or sent to a hotel room only to nearly bleed out, and some of them worse, without proper protocols in place. The reason that HB 1360 is so important is that on December 16th, 2021, the FDA announced that it would no longer require an in-person medical examination and allow the drugs to be mailed to the patient, meaning that for the first time in United States history, pharmacies may fill prescriptions for these drugs as they are, if they are certified to do so, without in-person reviews. The use of this drug represents significant medical risks, including uterine hemorrhage, viral infections, abdominal pain, cramping, vomiting, headache, and fatigue. Pelvic inflammatory disease is critical for for a qualified physician to determine blood type and administer the appropriate remedies if a woman is Rh negative, so there is no incompatibility for future pregnancies. The risk of complications increases with advancing gestational age and with the failure to either complete the two-step dosage process of the regimen or to receive abortion pill reversal care from a qualified healthcare professional. All of these things endanger Maryland women. Studies document that increased rates of complications include incomplete abortions, occurring even within the FDA-approved gestational limits. As of March 2020, the FDA reported 4,480 adverse events after women used this drug for abortions. Among these events were 1,183 hospitalizations, 339 blood transfusions, and 256 infections, including 48 severe infections. And this reporting system is known by different studies, including New England University studies demonstrating that as little as 1% of the contraindications are actually reported. Data on medical abortions show that at least 3% to 8% fail to evacuate the pregnancy tissue and require surgical completion. 1% will fail to kill the fetus. If surgical completion is required after a failed medical abortion, the risk of premature delivery in a subsequent pregnancy is more than 3 times higher, and failure rates increase as the gestational age increases. After enacting a new abortion complication reporting law in 2019, Arkansas found that of the 45 complications reported in 2020, 40 of them, or 88%, resulted from chemical abortions. A woman's ability to provide informed consent regarding these matters depends on the extent to which the woman receives the information sufficient to make that informed choice. In fact, our culture in the West and in America depends upon informed choice of our citizenry. The decision to abort is an important and often stressful one, and it is desirable and imperative that it be made with full knowledge of its nature and consequences, which was stated in Planned Parenthood v. Danforth, 428 U.S. 5267, 1976. To promote its interest in maternal health, life, and protection of women, the state maintains an interest in collecting specified democratic information on drug-induced abortions performed in the state, collecting information on all abortion, complications from all drug-induced abortions diagnosed or treated in the state, and compiling statistical reports based on abortion complication information for future scientific studies and public health research. The purpose of this bill is to protect the health and welfare of every woman considering a drug-induced abortion, to ensure that a physician examines a woman to reduce unnecessary risks, to ensure that a physician does not prescribe or dispense an abortion-inducing drug beyond the 70th day of gestation, and to reduce the risk that a woman may elect an abortion only to discover later that her decision was not fully informed. This bill promotes the health and safety of women by adding to the medical and public health knowledge through the compilation of relevant data on drug-induced abortions performed in the state, as well as on all medical complications and maternal deaths resulting from these abortions. Women demand the right to make an informed choice for every medical procedure. And this procedure is no exception. And so I respectfully request a favorable report on HB 1360.
Thank you, Delegate. You can move to 1369.
Thank you, Madam Chair, members of the committee. House Bill 1369, Public Health Standards and Reporting of Abortion, is an important bill before you today, because as we sit here, we understand that each one of us has a beating heart. If anyone would have our hearts stop beating, we would know the danger immediately. We would not be alive if it doesn't continue to beat. Now, not everyone may have a heart that beats on its own. There may be a pacemaker or two in this meeting, I don't know. But even so, the heart is pumping, and that means you're alive. With help or not, your heart is beating, and that means you have the opportunity to make your own judgments and to enjoy life. The same is true for every baby. It's true for every baby in the womb. This bill is very simple and is based on the heartbeat of a live baby. A physician may not perform an abortion before conducting a physical examination of the pregnant woman and her unborn child to determine if there's a fetal heartbeat present. If a fetal heartbeat is detected after an examination, and if the gestational age of the unborn child is at least 24 weeks, or no fetal heartbeat is detected, and a physician does not determine that an abortion is necessary to save the life of a pregnant woman. This bill also seeks to promote maternal health and life by adding medical and public knowledge to the compilation of relevant data. Opponents to fetal heartbeat bills currently say that heartbeats are not a sign of life. This is an intellectually lazy argument, because of a lack of a heartbeat is a sign of death. You can have a heartbeat with no brain activity, but you cannot have brain activity other than a few moments of residual activity if there's no heartbeat. A heartbeat equals life. Please return a favorable report on HB 1367 and show that you value the most innocent and helpless life in all of Maryland, an unborn baby with a heartbeat at risk of an abortion. Thank you, Madam Chair.
Thank you, Delegate. And then the last one is 1364.
Thank you, Madam Chair, members of the committee. House Bill 1364, the Healthcare Freedom of Conscience Act, authorizes healthcare providers and healthcare practitioners to decline to participate in a healthcare service that violates their conscience. It authorizes healthcare payors to decline to pay for healthcare services or healthcare products that violates their conscience in Maryland. It establishes civil, criminal, and administrative immunity and prohibits the state or local governments from discriminating against healthcare providers, healthcare practitioners, or healthcare payors and other medical professionals because they decline to take certain actions that violate their conscience. Freedom of conscience is a universal freedom that each of us exercises daily. Every time we consider an action in terms of I should or shouldn't do something, we're making a conscious decision. We decide a course of action based on what we think is best. It may include religious, moral, or ethical thinking or something else. But freedom of conscience is defended and defined both in the United States Constitution and, in universal applications and understandings such as the United Nations. Our most fundamental responsibility is to stand up and act for everyone's right to free choices, and particularly for everyone's freedom of thought, conscience, religion, or belief. We affirm our commitment to the universal norms and standards included in Article 18 of the International Covenant on Civil and Political Rights, which does not permit any limitations whatsoever on the freedom of thought and conscience or on the freedom to have or adopt a religion or belief of one's choice. These freedoms, unconditionally protected by universal norms, are sacred and inalienable entitlements according to religious teachings. Conscience shapes human choices and distinguishes human beings from other creatures. Freedom of conscience is at its heart, but still larger than freedom of religion or belief. It covers all ethics and all values in the human being of which we cherish, whether religious in nature or not. There are no admissible limitations to this freedom as long as personal convictions are not imposed on others or harm them. While it may seem evident, respect for freedom of conscience is hard to attain. People tend to judge convictions of others. Furthermore, it is very common that those who hold a conviction defend it. What is less common but more needed is that we all stand up to defend everyone's right to their own convictions. This bill does not ban any procedure or prescription and does not mandate any particular belief or morality. In fact, it's exactly the opposite of that. It simply provides medical professionals and healthcare workers the guarantees that this country was built upon, the right to be free from coercion, to do something that they believe is morally or religious or in other ways wrong. Protecting conscience helps ensure that healthcare providers enter and remain in their professions, helping to meet the rising demand for quality of healthcare. We've seen this happen in the last 2 years, and particularly the last 10 months, where many people were let go from the healthcare community because of their conscience decisions. We should not allow that to be exacerbated, particularly in the face of the abortion amendment to the Maryland Constitution. The argument that medical procedures should not be subject to freedom of conscience objections is frequently used and is the most fallacious. Women claim that they have a right to an abortion, and a certain doctor and insurance company must provide it, because otherwise that injures their right to get an abortion for those women who desire abortions. But it does not. They're misguided. There are other doctors and other insurance companies that they can go to for their abortion. And let's look at this concept in other professions. Let's take dentistry, for example. Some dentists choose to provide their services for children and do not treat adults. They may feel that it's more important for children to have their teeth taken care of than adults, or feel that children are more enjoyable to work with or more challenging. Regardless of why they choose to limit their practice of who they will perform dentistry on, we accept it because it's their freedom. No one tells pediatric dentists that they must see adults. Meat markets sell only meat because that's what they choose to do. No one tells them they have to sell vegetables or sofas. Freedom of commerce and freedom of thought are clearly combined. And in this case, this is the most essential freedoms that we hold as Americans, freedoms that go to the depths of the heart and soul and absolutely impact the future generations of how a religion or faith is played out and practiced. Coercion is what is happening today to medical professionals. It is inappropriate and wrong to coerce medical professionals to perform abortions or to do anything that would violate their conscience in the context of taking another's life. It violates the Hippocratic Oath. It violates their calling as why they became a healthcare professional. This committee can protect them today with HB 1364 and give medical professionals the same protections against coercion as each of us have as seated delegates in this House of Delegates. I respectfully ask for your favorable report on this bill. Thank you.
Thank you, Delegate. And you're right on time. Thank you very much. Committee, what I'm going to do now is the witnesses that have signed up on multiple bills, they will have 4 minutes. I'm going to take the favorables first. Ms. Bogley, you have signed up for 583, 1360, 1369, and 1364. You may proceed with your testimony.
Unmute, here we go. That's right. Thank you, committee again. Laura Bogley, Maryland Right to Life. It's my privilege to support multiple bills today that defend the God-given and constitutionally guaranteed right to life for all human beings. I want to thank Delegate Dan Cox for introducing these important bills that are not extreme, but present common sense solutions for Maryland women facing unsupported pregnancies. I say unsupported, not unplanned, to point out the dire need for life-saving alternatives to abortion in Maryland. Women don't want abortion. In fact, 74% of women, again, say they did not choose their abortion, but felt coerced into abortion. When women feel they have no other choice but to abort their children, this state has failed. After nearly 50 years of this genocide, legal abortion has dramatically failed to resolve the societal and economic challenges women face in raising our families. And Planned Parenthood, with billions in taxpayer funding, still has utterly failed to prevent unplanned pregnancy while increasing their share of the abortion market. And the overwhelming majority of people agree that public policy should support the lives of both mothers and children. Maryland Right to Life is supported today by a number of excellent witnesses who can explain how the state can correct course and put women and families before abortion, profits, and politics. These bills will empower women to make an informed choice, protect citizens and providers of rights of conscience, speech, and free exercise of religion, as Delegate Cox just discussed, will protect human beings with beating hearts and those with disabilities, more than 80% of the time, those disabilities are misdiagnosed. When they are diagnosed, families deserve support, not abortion. And finally, these bills will establish basic medical standards to protect women's health and safety against dangerous procedures and lethal chemical abortion drugs. The majority of people polled, whether pro-life or pro-choice, oppose public funding for abortion. But as we've discussed, Maryland is extreme and is one of only 4 states that force citizens to pay for abortions through Medicaid. Again, nearly 10,000 abortions last year. And these were elective. Less than 10 were reported for reasons of rape, incest, or to save the life of the mother. We heard a lot of rhetoric on the floor today, but these are primarily, substantially elective abortions. And so if this assembly, again, fails to invest in life-saving alternatives to abortion, you will be denying women real choice. We appeal to you to prioritize the state's interest in human life and restore to all people, born and preborn, and our natural and constitutional rights to life, liberty, freedom of speech, and religion. I urge you to bring these bills to a vote. It's very important. Year over year, all pro-life bills are denied a vote, which is a violation of the due process rights of citizens in Maryland who have gone to great effort and expense to elect pro-life legislators, only to have our pro-life speech restricted in one form or another. In 4 years of presenting to this committee, not one pro-life piece of legislation has been brought to a vote. Again, these are common sense solutions for women and families. So we urge you, bring these bills to a vote. If you feel strongly about abortion, then be willing to go on the record and let your vote stand for itself. Again, we urge your favorable report on these bills. Thank you for your time and consideration.
Thank you. The next witness that has signed up is Vince McAvoy and will be speaking on 2 bills, 1369 and 1364. Mr. McAvoy.
Thank you. I think I signed up for 3, but I do want to start with 1364 to go for Dan Cox's bill here, not for the bill that we're about to hear. Because this is a bill regarding the conscience of people who are trained, and any other day of the week, people in this committee would take their word on these issues. But when they come to my church and they have they call it the white robe mass, where they advocate pro-life, all of a sudden in this state, they're pariah. They talk about being oppressed. These are trained doctors. They're helping the health of Marylanders, and we should not have subjected them to acting against their conscience, either directly, financially, or through coercion. But that happens in the state. So I urge you to give 1364 a vote. And I'm hoping that you'll hear from some doctors who will tell them that they don't like being coerced and that they feel like their rights are being trampled on, their rights of free speech, their right to pursue happiness in their field. It's wrongful what we do. I know firsthand, and I've heard the stories of these doctors from the pews, and it's wrongful. I want to say that I again want to point out that the people who provided these bills, and especially Dan Cox, he's got so many bills here that look at the vast amount that he's written on these things and how much input he's put in regarding women's health. So when you go to a bill like 1360, this thing goes on for 28 pages. And I got to tell you, I'm a little bit out of my depth in it. I'm not even going to fake it. He talks about all manner of issues regarding this, from the constitutional right that is being demanded on the House floor, and how this is going to damn women. When you're talking about, they're talking about on the House floor requesting health care. You're requesting health care for something you're going to need to go back in for health care. He iterates all the adverse events that are going on with the abortifacients, my Prestone. And he also mentioned something that I was sort of new to, which was the Hippocratic Oath actual text, right? We always hear it, and we say, "Oh, first do no harm." I want to read this to you because I think it's going to change the way that you look at the Hippocratic Oath. Third paragraph in, it says, "I will use those dietary regimens which will benefit my patients according to the grace, ability, and judgment, and I will do no harm or injustice to them. Neither will I administer a poison to anybody when asked to do so, nor will I suggest such a course. Similarly, I will not give to a woman a pessary to cause abortion, but I will keep pure and holy both my life and my art." This is an understanding going back to the 3rd century AD. What is going on in our state and in our country, where we're killing our own. These aren't vast armies coming. We're purposefully have a state that's advocating for women to kill their own. This issue would not be what it is, but not for the absolute push by the industry. Am I out of time?
Yes, sir, you are.
Okay.
Thank you so much for your
Thank you.
testimony.
I urge all of Dan Cox's bills. I didn't speak on the Down syndrome, but all of them favorable. Thank you so much for listening, committee.
You're welcome. The witness by the name of Christina Ballman, will you speak favorably on House Bill 583 at 2 minutes?
Yes, thank you, Madam Chairman and members of the committee, especially you two, Delegate Cox. My name is Tina Bauman, and I'm here on behalf of the Padre Pio Haven of Hope for Life, Womb to Tomb. And I ask you to support the Down Syndrome Dignity Act for a variety of reasons. As a retired nurse, having served patients in Maryland for over 50 years, as a wife of almost 50 years, as a mother of 4 with 2 special needs children, and as a sister of a woman who died at the age of 53 with Down syndrome, I speak now from experience and from my heart. My sister Pam was born in 1963, perfectly healthy. My mother was told to put her in Rosewood State Hospital because she would not live 2 weeks. For 52 years, she remained healthy and was a blessing to every member of our family, teaching us the importance of what it really means to love one another. Love was an action word in our house, and Pam was always part of that action. Although she had an IQ of 30, she knew how to dance and sing and hug. Wild Thing was her favorite song. Pam also would eat all the candy out of everyone's Easter baskets unless carefully watched. So we knew she could also think for herself and have fun doing it too. We as a nuclear family learn the importance of patience, giving of our time and talents, sharing, and just plain wearing our love. So it showed her how much she meant to all of us. My mother even started a daycare center so Pam could be around typically developing peers. I stayed with Pam the last 3 weeks of her life, and it was for me something that made me a better human being and a blessing. Let's embrace life from womb to tomb, regardless of what a screening or diagnostic test may report. Life can be messy and marvelous at the same time. Isn't yours? I know mine is. Let's not become another Iceland that eradicated Down syndrome completely. Let's
Thank you, Ms.
celebrate their
Bowman.
as
Need
we
to wrap up.
should all lives. I fully support this bill and recommend you do the same. Thank you, Madam Chairman.
Thank you for your testimony. The next witness we'll have is Seth Rack.
Thank you, Madam Chair, for this opportunity to speak. I'm going to talk today about something that's very close to my heart. I'm an adapted physical education teacher, and I've spent my career in Maryland giving students with severe disability access to sports and physical education that most people take for granted. I've dedicated my career to fighting for equality for the most vulnerable people in society, which is why I ask you to support House Bill 583, Down Syndrome Dignity Act. One thing I've learned through my experiences as a teacher is that as much as I have taught kids how to throw, catch, and jump, they've taught me many more lessons in return. I've had countless students with Down syndrome in my career. I wish you could meet Logan, now an adult with Down syndrome, who learned 3 varsity-like corollary sports and was a hero at his school. He was universally loved by the entire student body. But by protecting preborn with children with disabilities or even suspected disabilities is something I believe the state of Maryland needs to come around on. When my wife and I were pregnant with our first son, Matthew, an early ultrasound showed an increased nuchal fold, which is an indication that something might be wrong. That something might be a chromosomal or heart defect or skeletal malformation, or it could be nothing. We went through various prenatal monitoring throughout all 9 months, and thankfully that something did turn out to be nothing. He's almost 11 years old and a star soccer player, football enthusiast, and potential clarinet phenom. My wife and I were horrified to learn that it was recently revealed that prenatal screenings, which OBGYNs have come to rely on, are up to 85 to 90% inaccurate in identifying prenatal diagnosis of Down syndrome. Many parents use this faulty information to end the life of their preborn children. Our current laws have a special exemption for late-term abortions for children with disabilities like Down syndrome. A disability by itself is not fatal, just difficult. This doesn't reflect the values of Marylanders.
Mr. Rack, your time has concluded.
Oh, thank you.
Go ahead and wrap
So I
up.
urge you to support this bill. Thank you.
Thank you. The next witness we'll have is Maria Hayden.
Hello, I am a vascular access board certified registered nurse. House Bill 1360 outlines the risks of abortion-inducing drugs and how they could be mitigated with thorough, prudent safeguards. No other ingestible chemical would be accepted without a doctor's examination, informed consent, and records of outcomes. I cared for a woman who took chemical abortion pills at 8 weeks gestation. She thought everything had gone as expected, but not all of her baby had been expelled. A week later, she became extremely ill, septic, which means the infection from her uterus had spread to her bloodstream. This happens when the cervical mucus plug is dislodged and bacteria can then feed on the decaying tissues. She could have died. Fortunately, she got herself to the hospital, had a D&C, and was on IV antibiotics for weeks. Ironically, I needed to get a consent to do her IV, but she didn't need one for the abortion that put her in the hospital. Hers is not a rare case. Surgical intervention is needed 4 times more often for chemical abortions than surgical. Fatalities to women are 10 times from infection alone, and 51% of women hemorrhage. Why do chemical abortions have so many more complications? Well, when needles, suctions, curettes, drills, and forceps are used, the baby can try to wriggle away, but ultimately will perish and be completely discarded because the doctor will insure it most of the time. A 10-week-old fetus is well developed. His internal organs are all in place. He has bones, a 4-chambered heart, tooth buds, and he starts to produce testosterone. The placenta that supplies all the food and oxygen to the baby is firmly adhered to that uterine wall. At home, even though the chemicals are powerful, so is the life of that child. He fights to survive, clinging to his mother's womb. At home, it's harder to kill a baby. And when chemicals fail, it causes injury and it can be fatal to the mother. If a girl gets these pills at home,
I need you to go ahead and wrap up your time. Thank you.
My last sentence is that if a girl gets these pills at home, she's alone, she's had no appointment, no information, and she bleeds or is infected, will she know what to do? Do you want these disastrous consequences on your conscience if you do not support House Bill 1360? Thank you.
Thank you. Thank you for your testimony today. The next witness is Paige Burns.
My name is Paige Burns, and I'm the director of the Catherine Foundation Pregnancy Resource Center in Waldorf, Maryland. We provide many services, including pregnancy tests, ultrasounds, and the abortion pill reversal. We empower women by giving them comprehensive information about pregnancy options and the possible outcomes of those decisions. We want women to have real choices, not to be coerced. The reality is that abortion is dangerous. There are medical risks involved with all abortions, but self-managed chemical abortion carries a higher risk. Regardless of the risks they face, many women without resources will decide or be forced to take abortion pills. It is critical for women to be examined by a physician before being given these drugs to determine specific health risks. But that leads to the fact that there is a procedure called the abortion pill reversal, which is mentioned in this bill. It's available, and we've seen evidence of the fact that it works. One couple who had regrets after taking the abortion pill reversed the process, which resulted in the birth of a healthy baby girl who will be 3 years old next month. Her parents were able to continue their professional careers, and they've expressed to us over and over again their extreme gratitude for their child's life. Another mother went through the process after regretting taking the abortion pill and explained how difficult it was to find information about the reversal possibility. She even contacted the abortion pill provider only to be told there was no way to reverse the process, which is completely untrue, and was advised to take the second set of pills, which she did not do, and persisted in her search until she was finally able to contact us. Abortion pill reversal advertisements have been suppressed. Some abortion pill providers deny the existence of the reversal protocol, or worse yet, they say it is dangerous. Most people aren't even aware that abortion pill reversal is possible. Shouldn't we want people to make informed decisions? The reversal information should be presented to a woman with the abortion pill because she has the right to know. The reversal protocol is time sensitive and no one should have to search through a myriad of information to find it. So I urge you to support this bill, HB 1360, that would require the abortion reporting, the information dissemination about all available choices.
Please wrap up, ma'am.
Put the safeguards in place, protecting women. Thank you.
Thank you. The next witness we'll hear from is Mary Shu. I may be pronouncing that incorrectly. And also I noticed that she is signed up on multiple bills.
I'm here.
Okay. Oh no, I'm not gonna let go for it without you. Hold on. I wanted to let you know that you were signed up on 2 bills. So we have you for 1360 and 1364, and you'll have 4 minutes to provide your testimony. And you have a beautiful baby in the background.
Yes, I do.
Proceed.
And so I'm Mary Zock. I'm the director of the Center for Human Dignity for Family Research Council and a full-time working mom. So I hope you won't mind the presence of my youngest coworker here with me today to testify on behalf of his friends in the womb. Here today to testify, Family Research Council is in support of House Bill 1360, the abortion-inducing drugs bill that provides common sense regulations on abortion-inducing drugs. There are inherent health risks associated with these drugs, and that's why historically they've been subject to certain federal safety protocols. The lack of in-person examinations, follow-up appointments, and complication reporting requirements put women at even greater risk for serious complications, including hemorrhaging, fallopian tube rupture, and even death. Most states do not require abortion complication data to be broken down based on abortion type. However, as Delegate Cox mentioned, Arkansas passed legislation in 2019 requiring this breakdown. And the 2020 data shows that 88.9% of abortion complications in Arkansas are the result of drug-induced abortions. And that makes Joe very upset. She's crying about that. Passing this legislation is the first step to preventing similar tragedies from occurring in Maryland. And I urge you to support HB 1060. Family Research Council is also supportive of the Healthcare Freedom of Conscience Act, HB 1364. The Freedom of Conscience Act allows healthcare professionals to provide what they deem to be the best care for their patients. Since the creation of the Hippocratic Oath, medicine has always been concerned with doing what is right and avoiding what is wrong for patients. Today, however, there's not always a consensus among medical professionals as to what is right and what is wrong. When these situations arrive, doctors must have the authority to act in accordance with their conscience. Without freedom of conscience, the patient or the hospital administration takes on the role of healthcare professional, and the healthcare professional simply becomes subservient to their wishes. Healthcare professionals are meant to be healers. This role cannot be maintained if the healthcare professional is not granted the protections necessary to act in accordance with what they believe is best for their patients. Failure to protect their freedom will drive healthcare professionals out of the profession or out of the state. Here in Maryland, abortion laws are out of step with most of the Western world and are comparable to those of North Korea and China, allowing an unborn child to be killed up until the moment of birth. Without freedom of conscience protections, healthcare professionals who do not wish to have any part in killing an unborn child will have to leave the state or the profession. Driving healthcare professionals out of the profession will limit access for patients. The COVID-19 pandemic has highlighted how essential healthcare professionals are to our communities thriving. Without these protections, doctors will be forced to choose between living in accordance with their deeply held beliefs and living in Maryland. Many will choose to leave the state. The Healthcare Freedom of Conscience Act provides protections for healthcare workers to practice medicine in accordance with their conscience. In doing so, it ensures that medical professionals are able to provide the treatment they believe is best. It provides diversity in the medical field and combats the healthcare worker shortage. I urge you to pass this legislation. Thank you so much.
Thank you for your testimony and your little assistant.
He says thanks.
Our last witness for our favorable panels are Cynthia Ritter.
Hi, thank you so much for having me here to testify in favor of House Bill 1364, the Healthcare Freedom of Conscience Act, because I've seen firsthand how our faith-based medical clinic has helped over 35,000 women in our 40 years of services with alternatives to abortion. As the director of Pregnancy Center North, a medical faith-based clinic in the Towson area of Baltimore, I've witnessed the impact the center has on the most vulnerable populations in Baltimore. Through our free medical, educational, and support programs, we help stop the cycle of abuse and neglect and empower women to become strong, confident mothers. Our staff, healthcare professionals, and volunteers align with our belief that life is a precious gift from God. We could not violate our conscience to offer anything but pro-life, healthy alternatives to abortion, and we know it works. I've been the director for 17 years, and I've seen it for myself with my own eyes. Like the 24 faith-based medical pregnancy clinics in Maryland, we are completely supported by private donors and accept no government funding. We see women from all walks of life and all belief systems who are seeking solutions to unplanned pregnancies, as well as those who are wounded by abortion. Every day, we see and hear how our services and long-term follow-up change and save lives, offering free pregnancy tests, ultrasounds, prenatal care, referrals, community resources, as well as material assistance like safe car seats and cribs. Our educational program addresses a healthy pregnancy, good parenting, and life skills to change the trajectory of lives in a positive way. Imagine the tens of thousands of women and families we've helped because we use our freedom of conscience to help women choose life. We implore you to please protect our rights to decline to counsel, advise, or refer for abortion, contraceptive services, or other services that violate our religious, moral, and ethical beliefs. A world without pregnancy centers like ours would be a world of lost, wounded women and broken families. Thank you so much for listening to me today.
Thank you. Thank you so much for your testimony. That is all of our favorable witnesses. At this time, I would like to ask the committee if there are any questions for our bill sponsor, as well as the favorable witnesses. And the hand that I see is Delegate Chisholm.
Thank you, Madam Chair, and thank you, Delegate Cox, for bringing all four of these bills. Obviously, I'm in strong support of all four, but the one I really want to focus on is 583, and I'm going to hold this up, and forgive me, it's an old picture, but I hope you can see that. That's my wife's Aunt Brenda, who moved in with us 15 years ago and lived with us until 2 years ago. And now she lives part-time here and the rest of the time down in Florida with my in-laws. And I don't know if you've ever gotten the opportunity, Delegate Cox or anybody on the committee, to go to, like, she worked at OBI, which is Opportunity Builders over in Millersville, did some work with Providence Center and Bella McCree, and that community of people will change your life if you ever get around them. I mean, we've all been to like those high school dances where everybody's on opposite corners and nobody, they're so uninhibited. The music comes on and they're the happiest people that you've ever seen in your life. Everybody's on the dance floor. They're having the best time of their life. And every time you see them, if they recognize you at all, you're the best friend, and you could never do any wrong in their eyes. And they're so excited to see you and to see the way that it's not the way that you affect their life. It's the way that they affect the lives of people around them. It's almost impossible not to just have your heart jump out of your chest when you get around some of these Down syndrome, these community people that are almost selfless at times, and all they really care about is almost making you feel good, and they're so excited to see you. So I just want to thank you for bringing that bill. It obviously means a lot to me. All four of the bills are precious, but that one there obviously has a very special spot in my heart, and I want to thank you for bringing it, and I appreciate you doing it.
Thank you, Delegate.
Thank you.
I concur.
And if I can remind the committee, let's make sure we're asking the witnesses questions. Thank you.
Is that so?
Yes, sir.
That's very so. Thank you, Delegate.
Delegate Saab.
Thank you, Madam Chairman. I actually, I just have more of a comment. I know Delegate Cox had an issue with the way the bills were all, I guess, combined. And I just, I realized that Ms. Vogley had signed up to testify on all four. And I just wanted to see if she still has anything else to say, or she was able to testify on all four bills.
Thank you so much, Delegate Saab. I could probably give 20 minutes on each of these. So what I'd like to do is make sure to follow up with all of the members of the committee and make sure you have my full testimony so that you have the benefit of all of the information. And I thank you for your question.
Thank you, Madam Chairman. Appreciate it.
And also let me make the committee aware that actually our witnesses have actually had more time than what would have been given on the original plan. So we are very much in line with what we need to do. Delegate Kelly.
Thank you, Madam Chairman. My question is also for Ms. Vogley. I was so heartened to hear you say that society has failed the women who want to carry their children to term. I agree with you completely on that point. And I would really like to know what Maryland Right to Life is doing to support the paid maternity leave bill. We know that only 25% of women in Maryland have access to paid maternity leave. I also know that in the past, we passed legislation to help even unpaid maternity leave for small business employees. We've got 25% of Marylanders still don't have access to that. And I would really like, I know that we do not agree on everything, but I have heard the volunteers today from the crisis pregnancy centers who I believe really, truly believe they want to help women carry their pregnancies to term happily. And I would like to know what Maryland Right to Life is going to do to ensure that we can have support for that legislation.
Thank you, Delegate Kelly, for your question. I did hear you make that statement on the floor today. And so we are in agreement that the state needs to do more to empower women to choose life for their children. And I personally am in support of well-structured maternal leave, family leave, not just maternal, family leave plan and support. I do believe the state needs to talk about doing that responsibly. And again, that's something that I believe we cannot shift the burden to unlimitedly shift the burden to state taxpayers or to employers. That's something where I want to empower and encourage the private sector to support, especially faith-based and community organizations, which is why it's so important right now that the state not infringe on religious freedoms for these faith-based organizations who are already doing that good work. So Maryland Right to Life partners with organizations because our mission statement is limited, but we partner with other organizations that do things like support father's rights, family leave, and other support. We partner with Democrats for Life on areas where we can do that. And I think that they have tried to testify before this committee and been denied that opportunity. So we do try to collaborate in that regard. And we are always open to good, clean bills that we can support within our mission statement that do not also have pork or hidden funding or advancement for abortion.
Thank you.
Thank you, Delegate Kelly. Are there any other questions from the committee? Okay. Not seeing any at this time, I would like to move to the unfavorable witnesses. The very first witness that we have is Robin Elliott. And I have you signed up for two bills, 1360 and 1364. And that will be 4 minutes.
Thank you, Madam Chair. Members of the committee, Robin Elliott here on behalf of Planned Parenthood of Maryland in opposition to House Bill 1360. This bill is about the medication used in medication abortion called mifepristone. And mifepristone is approved by the Food and Drug Administration for use, has been approved for over 20 years, and mifepristone is incredibly safe and effective. This bill would set Maryland back by requiring, first of all, only a physician may prescribe mifepristone. That is something that the 2020 Attorney General's opinion recognized that there are other prescribers who have it within their scope. It would prohibit the provision of mifepristone through telehealth. It would impose a 24-hour waiting period. This could be devastating to individuals who are in rural areas or who lack transportation or who cannot get additional time off of work. It would require healthcare practitioners to provide false information about healthcare risks of medication abortion through mifepristone and abortion reversal method, which is unproven. And in addition, it would impose criminal penalties on healthcare practitioners. This is unlike any other provision of Maryland law, singling out abortion providers for enhanced penalties is a way to decrease the number of providers available and therefore decrease access to safe abortion care in Maryland. So with that, we would respectfully ask for an unfavorable report. And then on House Bill 1364, we are also in opposition. I will just briefly mention that this bill is much broader than abortion care. this would allow healthcare providers and insurers to not provide care or coverage on any healthcare service for which they had a moral objection. There is no standard. This could literally be any healthcare service. Maryland's law already has a refusal provision related to healthcare providers not being required to provide abortion care and artificial insemination. Maryland's law also already recognizes religious exemptions for birth control and perhaps soon to be abortion care services. This would allow any individual, any organization that has a moral objection, not just a religious organization. So we would ask for an unfavorable report. Thank you.
Thank you, Ms. Elliott. The next witness that is unfavorable is Laura Ruth. You have 4 minutes, Ms. Ruth.
Good afternoon, Madam Chair, members of the committee. My name is Laurie Ruth. I'm the legal director at the Women's Law Center of Maryland. We advocate for women to be able to control their own bodies and for their bodily autonomy. We are here to oppose HB 583 and HB 1369. You have our written opposition to the bills that Ms. Elliott just testified on. As to HB 583, the bill that would prohibit selective abortion for Down syndrome, we oppose this bill for several reasons. It has been widely recognized that bills such as HB 583 are unenforceable, or in fact may cause a chilling effect between pregnant people and their healthcare provider. If they're seeking abortion care, if they can't speak frankly, a provider will not know how to make referral to really talk about what it means to have a child with Down syndrome. Efforts to promote rights of people with disabilities do not require compromising other fundamental rights. Bills like this are a strategic effort to chip away at viability issues and Roe versus Wade, which is still the law of the land. That comment that I just made comes directly from the Right to Life website. It is strategic and it is on purpose to try to infringe on protected abortion rights. And for those reasons, we oppose HB 583. As to HB 1369, we oppose this bill as well. It is unconstitutional in Roe, in Planned Parenthood versus Casey, in Gonzalez versus Carhart, which reaffirmed in 2007. Viability was determined to be the restriction in later abortion. And I know that the concept of viability is complicated, but I think that's because it's not a clear mathematical number. HB 1369 seeks to say that at 24 weeks, XYZ will absolutely happen. First, the CDC indicates that only a very small percentage of abortions are done at later term, somewhere around 1%. And most importantly, these pregnancies are often or usually wanted pregnancies. There's not a rampant epidemic of women all of a sudden at the latter end of their abortion deciding just for the heck of it, they want to go get an abortion. Each pregnancy is different. Defining viability as 24 weeks is not appropriate. And in the bill, prolonging and delaying, such as requiring a second doctor to sign off on a good faith effort and whatnot, just further agonizes the woman and may put her in medical danger. It interferes with the doctor-patient relationship. It is particularly cruel to place a blanket ban in these situations just because there is still a detectable heartbeat. That medically does not mean the fetus will live if it is born. Other factors impact viability, such as prenatal care, education and access to healthcare at all, singleton versus multiple pregnancy, fetal weight, post-child care that can be assessed. All of those impact viability. And it is really the province of the doctor in consultation, or the healthcare provider in consultation with the patient, with the pregnant person, to make these really difficult and complex decisions. In addition, the bill seeks to regulate the clinical setting in the same way it's inappropriate interference with medical practices. In terms of the reporting requirements in the bill, the CDC indicates clearly that Guttmacher is better at state reporting requirements than required under state laws. And for those reasons, we urge an unfavorable report on, I have the wrong bill number, HB 1369. Thank you.
Thank you, Ms. Ruth. That is the remainder of our unfavorable witnesses. At this time, are there any questions from our committee for the unfavorable witnesses? Okay, not seeing any, then this concludes the bill hearings for House Bill 583, House Bill 1360, 1369, and House Bill 1364. Thank you, Delegate Cox and all of your witnesses. The next bill that we will hear is House Bill 1230, Delegate Weibel.
Thank you, Madam Chair. It's good to be with you and the honorable members of the Health and Government Operations Committee. I am Delegate Weibel here to present House Bill 1230. House Bill 1230 prohibits dismemberment of a living unborn child through a procedure generally referred to as dilation and evacuation. I would like to show a video if I could. I believe I had cleared that yesterday with your committee. I don't know if they want to show the video or if they want me to share a screen.
I can inquire. Richard, do you have a preference?
You should be able to share your screen.
Okay, it says I can't. It says you cannot start screen sharing while another participant is sharing.
Try it one more time.
Okay, there we go.
We will let you know when your time has run out.
Thank you.
Levatino is a board-certified obstetrician and gynecologist. Over the course of his career, Dr. Levatino has practiced obstetrics and gynecology in both private and university settings, including as an associate professor of OB/GYN at the Albany Medical
I'm not
College.
sure it's sharing.
Dr. Levatino, we'll begin with you. Welcome. Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks. She's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called the Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion. So picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head in the baby that size is about the size of a large plum. Can't see it, but you pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. When you have a day like I had a lot of times, sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed the second trimester D&E abortion. You just affirmed her right to choose. Why did you end your practice of doing abortions? I did over 1,200 abortions over a 4-year period in private practice, not counting the ones that I did during my training. I met my wife during my first year of training at Albany Medical Center. We got married about a year later and found that we had an infertility problem. After years of failed infertility treatment and several years trying to adopt a child, we were blessed with adopting a little girl that we named Heather in August of 1978. As sometimes happens in those situations, my wife got pregnant the very next month, and we had 2 children 10 months apart. 2 months short of my daughter Heather's 6th birthday, she was killed in an auto accident and literally died in our arms in the back of an ambulance. Anyone who has children might think they have some idea of what that feels like, but unless you've been through it yourself, you have no idea whatsoever. I know people find it hard to believe, but what do you do after disaster? You bury your child and then you go back to your life. And I don't remember exactly how long it was after my daughter died that I showed up at Albany Medical Center OR number 9 to perform my first second trimester D&E abortion. I wasn't thinking of it as anything special. This was routine to me. But I reached in, literally pulled out an arm or leg and got sick. You know, earlier on, I described stacking up body parts on the side of the table. It's not to, gross people out, to use a simple term. When you do an abortion, you need to keep inventory. You have to make sure you get 2 arms and 2 legs and all the pieces. If you don't, your patient's going to come back infected, bleeding, or dead. So I soldiered on and finished that abortion. And I know it sounds, as I said, hard for people to believe, but I'm telling you straight up my experience. After over 1,200 abortions, first and second trimester up to 24 weeks and all the rest of it, and being very dedicated to it, for the first time in my life, I really looked at that pile of body parts on the side of the table. And I didn't see her wonderful right to choose, and I didn't see all the money I just made. All I could see was somebody's son or daughter. And I stopped doing late-term abortions after that, and several months later, stopped doing all abortions.
I find that video difficult to watch. What House Bill 1230 also does is it offers protections for the mother by providing a medical emergency exception if the mother's life or physical health is in danger. And it also provides—
Delegate, I just want to make you aware that your time has expired.
I'd be glad to answer any questions if anyone has.
Okay, thank you so much. The first witness that we'll have as favorable is Michael New.
Thanks. Again, testifying in my capacity as a concerned citizen. I reside in Hyattsville, Maryland. I want the committee to report on this bill favorably. This bill would protect, unborn children, not all of them, but certainly at a later stage of gestation. Again, there's very strong public support for protecting preborn children. After the first trimester, only 28% of people, according to the most recent Gallup poll, say abortion should be generally legal during the second trimester. Only 13% say abortion should be generally legal during the third trimester. So putting some limits on late-term abortions, I think, is certainly consistent with the wishes of most people. Also, there's research out there showing the health risks of abortion tend to go up the later in gestation the abortion is performed. Many groups out there try to downplay the physical health risks and the psychological health risks. But there is good research out there showing that after the first trimester, both the physical and psychological health risks of abortion do go up and do go up pretty substantially. So I want to throw that out there. And there's a lot of people who think that women, seeking late-term abortions only do so in unique cases, but research doesn't really back that up. A 2013 study in the Perspectives of Reproductive Health, that was a journal that was published by the Guttmacher Institute, which supports legal abortion. They found that most women seeking late-term abortions did not do so because of fetal anomaly. Look at 2 groups of women, one who were seeking abortions at 20 weeks, another after 20 weeks, and found the rationale for seeking abortions was basically the same. A congressional research report that came out in, I think, 2014 or 2013 arrived at a similar conclusion. Again, late-term abortions typically are not sought because of unique circumstances involving fetal anomalies. Again, I think this is a very good piece of legislation. I hope you all found that video very moving. I recommend a favorable report from the committee. Thank you.
Thank you for your testimony. The next witness that we have is Vince McAvoy.
Thank you so much, committee. And Delegate, thank you for bringing this bill again. This was yours and Senator Reedy's were the first bills regarding abortion I saw several years ago. Of course, he was on JPR at the time, so I just happened to sort of take an interest in what he was doing outside of JPR, and I saw this. And when I see that we still haven't made any progress along this, that is, that we haven't made any progress in treating human beings better than we would a roaster chicken. This is, I find deplorable that we're in this state where, well, I mean, if I know of at least 2018, it goes back maybe earlier than that. So I do urge a favorable for this bill. This is gruesome, and this is subhuman in our approach to this. And you're right, it is a moving video. I hadn't seen that particular piece before. I had seen the doctor that you would bring into to the dais before the previous iteration of this bill. I think I'm hopeful that the committee really takes a look at this and understands that they are inducing healthcare problems, as the doctors are saying on these videos, when these things go on. This notion of safe and effective, either physically, medically, or psychologically, it's just a falsehood. Thank you for listening, committee. I urge a favorable Doug with this bill. Thank you.
Thank you, Mr. Neal. The next witness we have is Deborah Mercado.
Hello again, delegates. We heard the testimony of Dr. Anthony Levatino, which was very difficult to hear, and it bears repeating. Dismemberment, the action of cutting off a person's or animal's limbs. Dismemberment, abortion, the purpose of causing the death of an unborn child, purposely to dismember a living unborn child and extract him or her one piece at a time from the uterus through use of clamps, grasping forceps, tongs, scissors, or similar instruments that through the convergence of two rigid levers, slice, crush, and or grasp a portion of the unborn child's body to cut or rip it off. Scientific studies have shown that unborn babies feel pain at 12 weeks. This procedure is usually done at 13 to 24 weeks, so we know this baby is experiencing the pain of having his or her limbs ripped off. Our laws need to protect and defend the dignity of the human being, including the unborn child. We're horrified at hearing the murder and torture of victims when their limbs are cut from their bodies before or after death. It's difficult to think about what's happening to this child. In addition to what is happening to the baby, we must consider the health and well-being of the mother. The mother is at risk of complications due to the sharp instruments used and the sharp edges of the baby's bone fragments caused by the dismemberment. The woman is at high risk for damage or perforation of her uterus, cervix, and other organs nearby. She is at risk of hemorrhage, infection, failure to carry a future pregnancy to term, and even maternal death. All of this can be found in medical articles and medical journals. In Maryland, we know that these complications have occurred at the hands of Leroy Carhart. I urge you to recognize the humanity of the baby and the health and well-being of the mother, and can vote favorably for this bill 1230. We need to protect human life. That's what our laws need to do, not torture people. Thank you very much.
Thank you. The last favorable witness we have on this bill is Laura Bogley.
Thank you again, Laura Bogley, Maryland Right to Life. I want to thank Delegate Weibel for bringing the Unborn Child Protection from Dismemberment Act. This is a humane bill that brings Maryland policy in line with current medical knowledge about human fetal development and the ability of the unborn child to feel the pain of their abortion. It's hard to imagine a more gruesome way to die. This assembly has advanced legislation to protect cats from the pain of declawing, which I support, and to prohibit cosmetic testing against animals, which I support. Unfortunately, they excluded that fetal human beings from cosmetic testing prohibition. But if veterinarians were ripping apart living cats or dogs to kill them in the same way that living human fetuses are being ripped apart in D&E procedures, the outcry among Democrats would be deafening. According to the American Association of Pro-Life Obstetricians and Gynecologists, human fetuses react to painful stimuli beginning at the second and third trimesters when D&E abortions are in fact performed. Fetal human beings who are victims of D&E abortions react to painful stimuli when the same psychological responses that any other, with the same psychological responses, physiological responses that any other human being would display. Increase in heart rate, increase in stress hormones in the bloodstream, and withdrawal from the painful stimuli, as we saw in the silent screen. The U.S. Supreme Court partial birth abortion ban made clear that states can ban barbaric procedures done in the name of elective abortion, especially those procedures which cause excruciating pain to living fetuses. Justice Ginsburg recognized that performing a D&E on a living human fetus is equivalently gruesome to performing a partial birth abortion procedure on a living fetus. And finally, the Supreme Court based its decision in part on, quote, the premise that the state, from the inception of pregnancy, maintains its own regulatory interest in protecting the life of the fetus that may become a child.
Ms. Buckley, your time has run out. You need to wrap up.
For these reasons, we urge you to act humanely and issue a favorable report. Thank you.
Thank you. The committee at this time, are there any questions for the favorable panel? Delegate Riley.
Thank you, Madam Chair. Yeah, I would like to hear what the sponsor of the bill, Delegate Weigel, had to say after the video, if you would, please.
Yeah, I'm sorry. I was trying to close the video and at the same time focus on providing testimony. I did finish with saying that the bill does offer protections for the mother by providing several things. For one, it does create an exception for a medical emergency if the mother's life or physical health is in danger. And it also provides certain legal protections for the mother, including the woman's identity to remain anonymous in any court proceeding and allowing a judge to exclude individuals from the courtroom. The bill does not ban an abortion performed using only suction or any other method not meeting the definition of the dismemberment or abortion. So those procedures are specifically excluded from the bill. Thank you, Delegate.
Thank you. Thank you for the bill.
Thank you. At this time, we will hear from our last witness on this bill, and that is unfavorable, and that is Robin Elliott.
Good evening, Robin Elliott. I'm here today on behalf of Planned Parenthood of Maryland in opposition to this bill. The bill bans the most common type of abortion procedure for second trimester abortions, known as the dilation and evacuation method. These bans have shown to be unconstitutional and are still unconstitutional in today's law. One of the reasons that these bans are so concerning is the risk to the pregnant individual's health. In an amicus brief filed in Kentucky against a very similar bill, the American Medical Association, the American College of Obstetrics and Gynecologists, and the American Academy of Family Practitioners wrote that this ban, quote, presents additional risks to patient health without offering medical benefits and are often experimental. So that is a direct quote from the amicus brief. I'll just further add that this bill, although it does have a medical emergency exception, the language is so vague, we think that providers would hesitate to provide this procedure because the language is vague and the penalties are very steep. We ask for an unfavorable report. Thank you.
Thank you, Ms. Elliott. At this time, are there any questions from our committee for the unfavorable witness? I see Delegate Saab.
Thank you, Madam Chairman. And Robin, thank you for your testimony. So I just wanted to see if I heard you correctly. So I think you said that the language is vague. So is there any way that Planned Parenthood would support this bill if there were any amendments or any suggestions that it could maybe clarify some of the vague language?
Thank you, Delegate Saab, for the question. Planned Parenthood of Maryland would still be in opposition to this bill because by banning this type of procedure for most people, even those that are not in a medical emergency, we would actually be creating more risk for women obtaining abortion care. So for that reason, we would still be in opposition.
And if I can follow up, Madam Chairman, real quick. So I remember this bill from a few years ago, and I think I asked somebody from the ACLU or if they felt, or does Planned Parenthood feel that this method is humane?
So Delegate Saab, I think the question before the committee is whether or not this is a valid clinical method and allowable under medical standards, and it is. I do not think that the question about sort of what people think about a procedure is particularly germane to this hearing. Thank you.
Well, I appreciate not answering the question, but do you think that the baby feels the pain?
Delegate Saab, I am not a clinician, but my understanding from the clinicians that I have spoken to is that the sort of discussion about fetal pain is not backed by any of the clinical evidence.
Thank you, Delegate Saab. Not seeing any more hands for questions for our unfavorable witness. This concludes our bill hearing for House Bill 1230. We will now move to our final bill, and I'm going to relinquish my chairmanship to our esteemed colleague, Delegate Cullison, for the final bill.
Thank you, Madam Chair. Thanks for running such a great hearing thus far. Good luck in your travels. So we are going to begin the final bill of the day, which is House Bill 50. This is Delegate Ampry. Public health, abortion, artificial insemination, and sterilization requirement. Welcome back, Delegate Ampry.
Thank you so much, Madam Chairwoman. And it seems that the HGO has become my home away from home this session, so I am back again. We've had a long day discussing these matters, and I know that it can be emotional and difficult, but I'll bring in the last bill, and I hope that it finds everyone well. For the record, Delegate Marlon Ampry here presenting on House Bill 50. This bill is being introduced for the purpose of requiring, rather than prohibiting, licensed hospitals, hospital directors, and hospital governing boards to authorize within the hospitals the performance of any medical procedure that results in artificial insemination, sterilization, or termination of a pregnancy, or to refer to any source for these medical procedures, and generally relating to hospitals and abortions, artificial insemination, and sterilizations. The bill is critically important to expanding equitable access to reproductive health options for people in Maryland. I know I have more data here to spew and talk about in court cases and all that, but I'm going to keep it short and allow for more time for those who are presenting in support of the bill. In Maryland, there are refusal of care laws in place that allows providers to refuse care for patients who are seeking medical procedures that result in artificial insemination, sterilization, or termination of a pregnancy. In the Code of Maryland, Article Health, General Section 20-214, persons licensed hospitals, hospital directors, and hospital governing boards are not required to permit or make referrals for the performance of medical procedures related to artificial insemination, sterilization, or the termination of a pregnancy. Additionally, these entities cannot face repercussions in the form of civil liability for refusing to permit or refer a source for these procedures. And I want to key in on that language there, refusal to permit or refer a source for these procedures. This bill comes from a constituent of mine who's had issues with where they would go to seek out care. And while the entity could refuse care, there was no obligation for them to actually refer them to someone who could give them the medical needs that they desired. In practice, this law allows doctors, hospitals, pharmacists, businesses, and insurance companies to withhold healthcare and refuse to provide complete information about medical options. Abortion has become a political issue despite the fact that abortions are safe, scientifically supported procedure that should not be denied to patients who are seeking it. HB 50 protects the liberty to choose to have medical procedures such as artificial insemination, sterilization, or termination of pregnancy without excessive government restriction by requiring medical professionals to provide or refer to these services. And I urge the committee to bring forth a favorable report, and I will give the rest of my time to those who are speaking in support of the bill. Thank you.
Delegate Ampry, I do not have anyone else speaking on support. There's a couple of written testimonies, but I don't have any witnesses.
Got it. So I was under the impression that I had witnesses, so I read that incredibly too fast. But I just would ask
So
that
you've still got 2 more minutes.
we got 2 more minutes.
Go
Look,
for it.
so I will just say that with this again, I want to focus on that point of the bill, and that one of the things this bill is trying to do is allow for there to be require that institutions that are refusing service, and institutions, you have the right to refuse services for religious reasons, for hospital networks and so forth. But in the event that they do, they should still work their hardest to help someone find the services that they need and desire. And that's what we're trying to require with this bill. And to just be a referral process that will be required. So I'll take on any questions. It's a pretty technical bill, but happy to take on any questions. And I'll just end it there so we can and get to the end of this Friday.
Thank you, Delegate. I do see a couple of questions from the committee. I'm going to begin with Delegate Kipke.
Thank you, Madam Chairman. Delegate Ampry, I'm having deja vu with you with another bill from earlier this session. And I'm curious, I think I heard you said this bill would not require a religious institution or hospital to perform these services. Is that, you're on mute?
This bill is not requiring them to do so, right? So what the key point of this bill is on the and part, right? Or the or part, and that it's going, you'd be required to refer. So if someone were trying to get to get artificial insemination, and the hospital that they went to or the network that they used said, no, we don't do that because we don't believe in that procedure, what have you. This would require them to no longer would allow them to refuse it and not also refer them to someone who would. So to say, you can't say no and just leave you in the dark. You have to say no, but here are the options that you have somewhere else. That's what our goal with this bill would be to do.
Understood, but doesn't that infringe upon their religious freedom by requiring them to provide basically a referral to do something that is against their deeply held religious beliefs? Doesn't that fly in the face of the longstanding belief that we have in this country and respect for religious freedoms?
I would not be at liberty to answer that question, even though I am an attorney.
Let me rephrase it.
So I don't want to say what is or what isn't a violation of someone's religious right. I feel as though we're just ensuring that someone seeking out a medical need should be able to get the medical need.
Little Sisters of the Poor.
I'm sorry.
There's a famous case with the Little Sisters of the Poor, that those really sweet nuns that care for people that nobody else wants to care for. They don't have the resources to care for them. They dedicate their lives and their religious mission to take care of people. Mm-hmm. Do you think it would be a violation of their rights, their religious freedom, if this government's going to force them to do referrals for, I don't know, abortions?
Well, again, this is not someone seeking out care by someone, right? This is someone seeking out care from a doctor or medical network that has doctors, overseeing of doctors who take an oath to provide care to people. So I'm confused by your question there, in that if we're talking about a doctor who is promising to take an oath to take care of people, and someone seeking out care, if they have a personal reason as to why they would not personally want to provide the services because of their faith and their religion, they have a right to do that. But at the point where you are supposed to be helping someone seek out medical care, I think the goal of this bill is to ensure that person seeking out the care is able to find that care. And the thing about this is that when we think about the health implications of those seeking out services, such as the ones listed in this bill, we know that it can be a situation where if you don't get the right care in the right way, it's dangerous, right? So this is an opportunity to provide better health care to individuals seeking it out. And again,
so to be clear, Delegate, you want to force a doctor or whomever to do something against their deeply held religious beliefs. Is that correct?
No, that is not. That would be an incorrect statement.
If I might interject, I think what the distinction here is, they're not being forced to do the activity, but this bill would force them to give the person information about where to find, where to find this service. That I think, we have to look into, but I think I just want to be clear about what the distinction is here, because there seemed to be some misunderstanding there.
I would agree with that.
Thanks for clearing it up. I do still think it's a violation of the United States Constitution, but thank you.
Yeah, I would.
Thank you, Delegate. I appreciate both of your patience and trying to work through the language. Delegate Chisholm.
Thank you, Madam Chair, and thank you, Delegate Amper. My question kind of follows along with Delegate Kipke, because I'm reading actually the physical note, and what we're really asking here is for somebody that doesn't want to perform an abortion or artificial insemination or whatever service, but we're really talking about abortions. But it says in the physical note, accordingly, the bill repeals protections from civil liability, disciplinary or other recriminatory actions for refusing to permit. So kind of building on Delegate Kipke's. So if they have a religious reason, they say, we don't want you for religious reason. I know we're trying to define what your definition of is, but it's really, this is opening up a huge can of worms for some of these doctors or hospitals that don't want to perform abortions or don't want to perform artificial insemination. You're in the state of Maryland, and you're looking for artificial insemination, everybody knows you go to Shady Grove. It's just a given. This bill, wouldn't you agree, really opens up a lot of these hospitals who are already having a hard time finding quality workers, opening up to lawsuits from all angles for not wanting to perform some of the things that may violate their religious beliefs or beliefs in for other reasons.
I'll disagree. I'll disagree two statements there. So first of all, this bill is not just about abortion. There's artificial insemination. So that's part. That's the first thing I will agree. But your claim there, this is not just about abortion. Second thing, in regards to liability, I mean, I don't think this opens up to a whole bunch of liability cases if people are able to comply with the law, number one, if we put it in place. The second thing is when you're looking at liability, there be a lot of pieces as to a person, for someone to prove that, but for their inability to refer a service is why something went awry with their medical care, right? So it doesn't open up directly to a whole bunch of cases as you make it seem. I would disagree with that statement. It's more so just opening up more access, opening up the access for people to make sure they get the care that they need.
But it says right in the bill, it repeals protections from civil liability.
Right, yeah. So yeah, it does repeal protections for civil liability as currently drafted. But at the end of the day, if you comply with the law, you won't see a civil action, number one. Number two, still within a civil liability, there still would be a lot for you to be able to display that, but for the actions taken by a medical network, that something went awry with your healthcare, to where you would have a strong enough case where we're seeing, the open the floodgates of law cases, as many people like to assume with certain type pieces of legislation. So I would disagree with that. This would necessarily open up a whole bunch of liability claims and put hospital networks in harm. I would disagree with that. I would say that this would just ensure that people get access to the care they deserve and need via referrals.
Well, you're saying if they comply with the law, but you're changing the law.
I mean, well, yeah, people comply with laws. We change that's what we do here. I mean, people have to comply with the law. So I'm just saying,
I'm gonna ask you to take the conversation offline.
Okay, all right, yeah, that's cool.
With each other, because I think the question's been asked and answered.
Thank you, Madam Chair.
Delegate Saab.
Thank you, Madam Chairman. Delegate, I'm still struggling because I want to follow up on Delegate Kipke's question.
Yes, sir.
I'm struggling. How is it that you're forcing a referral, which you're also asking them to promote indirectly something they don't believe in and is protected under the Constitution, their religious beliefs? So how do you not see that as infringing on their religious beliefs when you're forcing them to promote services they don't believe in?
I wouldn't. So I'm not promote. We're not. They're not promoting services, right? We're not asking them to put signs up in their offices. We're not asking them to do anything that promotes the service. We're only asking them that upon someone asking for a certain type of medical care they need, that they would be required to then refer them to someone that can provide them with that care safely and ethically. It's not making them. They're not even making them do it. It's just saying, hey, this is what you want. This is where you would need to go get those type of services. And you step away. It's not saying that you say you're not pushing them or promoting it. So I would disagree with the word promotion. It's just a referral to where they would need to get those services.
Right. The services that you're asking to refer to are services they don't perform. And your bill specifically mentions abortion and artificial insemination, things that we all know that some religious hospitals, they oppose. But we can take it on, on offline. I don't want to call the.
Thank you, Delegate. I appreciate that. Delegate Rosenberg.
I recognize I'm joining the conversation late because I was in another meeting, but if I may ask the sponsor, have you asked the AG's office for advice on the constitutionality of the bill?
I do not believe we've gotten an AG opinion, but I have their office on speed dial. I will reach out to them and get that opinion. And once I receive it, I will send it over to the committee.
Thank you.
Thank you, Delegate. We will watch for that. Seeing no further questions of the sponsor, I'm going to move to the unfavorable panel, and we're going to begin with Mr. Vince McAvoy.
Thank you so much, Delegate Collison and committee, for the last bill. HB 50, bill would force hospitals to perform abortions. That's what this bill is about. To say anything else is disingenuous. You can't do that ethically. You'd be obliterating the rights of conscience that we provide in lesser matters, like being called certain pronouns. And you're going to take away a doctor's religious conscience rights. Doctors will find ways to take this on, and that's already happened. We saw these kind of things in Philadelphia with something even relating to adoption, where this just happened in Philadelphia late last year, where the religious objections were honored. When you compare that with Delegate Cox's HB 1364, just no to this bill. I find this a very disingenuous approach by the junior delegate. It moves along this path of accept, tolerance, validate, and then you're going to be mandated to celebrate it. But just from a logistics standpoint, do you want somebody to refer you to something that they, in their core, don't believe in? Are you going to ask a vegan for the best barbecue joint? It's a silly bill. I urge an unfavorable, and I'll help you all finish up the night. Thank you so much to the two delegates who were hosting this, Delegate Sample Hughes, Delegate Culls. Appreciate it, and thank you for your time, and the committee for listening to all these concerns against abortion and all these bills. Thank you so much. I don't hear anything.
Delegate Collison, we can't hear you.
Is that better? Can you hear me now?
Yes.
Okay, great. I don't know what happened there. I apologize for our technical difficulties. I'd like to call on Olivia Summers, please.
Thank you. Again, I am Olivia Summers, Associate Counsel with the American Center for Law and Justice, testifying in opposition to House Bill 50 on behalf of the ACLJ and over 500,000 of our members, including over 6,400 from Maryland. House Bill 50 is a direct attack on the sacred right of conscience, which has been long described as, quote, the most sacred of all property, unquote. The fact is that it was in Maryland that the first law was enacted in our nation's history to protect individuals' right to freedom of conscience, and that was the 1649 Act concerning religion. Yet House Bill 50 would abrogate institutional conscience protections and coerce hospitals and other healthcare providers to provide or refer for abortions, among other things. As such, it directly conflicts with the US Constitution, Supreme Court precedent, and federal healthcare provider conscience protections laws, such as the Church Amendment, Section 245 of the Public Health Service Act, the Weldon Amendment, and Title VII's religious accommodation protections. These laws prohibit recipients of certain federal funding from discriminating against healthcare providers who refuse to participate in, including referrals for, sterilization procedures or abortions, contrary to the private provider's religious beliefs or moral convictions. These conscience protections are well established and longstanding, thus House Bill 50 would jeopardize Maryland's ability to receive certain federal funding should it be enacted. To be clear, these conscience protections laws prevent discrimination against hospitals, healthcare facilities, and other healthcare entities such as boards, in addition to individual healthcare providers. Therefore, the passage of House Bill 50 would instantly invite a religious liberty challenge, and it incentivizes mission-directed institutions to stay out of or leave Maryland, reducing healthcare options, not enhancing them. For these reasons, among others, the ACLJ strongly opposes House Bill 50. Thank you.
Thank you, Ms. Summers. Next, Laura Bogley, please.
Thank you, Delegate Cullison. Laura Bogley, Maryland Right to Life. What she said, what Olivia just said so articulate. Thank you. Yeah, we strongly oppose House Bill 50 and urge your unfavorable report. It might be great to adopt a rule in the future that a legislator gets an AG opinion before taking the time of the committee and the public to analyze bills that most likely would be found unconstitutional. Our federal and state constitutions guarantee the free exercise of religion for all citizens. Declaration of Rights prohibits the legislature from infringing on religious freedoms, which are the natural right of the people, pre-existing and independent of government. This bill attempts to deny the citizens of Maryland equal protection under the law and Constitution and force hospitals and medical providers to participate in controversial procedures in violation of the religious, moral, or ethical beliefs, which are an integral part of their business, mission, or ministry. State and federal laws are necessary to ensure that freedom of conscience is truly protected. We have a minimal a law, which now there are bills this session, more than one, to remove rights of religious freedom or religious exemptions when it comes to abortion policy. So this is a real threat. Without comprehensive protection, healthcare rights of conscience may be violated in several ways, such as harassment, demotion, salary reduction, transfer, termination, loss of staffing privileges, denial of aid or benefits, and refusal to license or refusal to certify, as well as unlimited lawsuits as a result of this bill. The consequence of this legislation, whether intended or unintended, would be the mass exodus of medical professionals and skilled workers from the healthcare industry in Maryland. The bill will create widespread medical scarcity, particularly in underserved areas where people are most in need of these services. A unique human life begins at the moment of conception. Protecting freedom of religion and conscience is common sense. We urge you to issue an unfavorable report on this bill.
Thank you, Ms. Bogley. And our last witness is Mr. Michael, I think it's Dr. Michael New.
Yes. All right, I want to thank everybody and thank for everyone's patience for what was a somewhat long hearing today. I just want to encourage opposition to this bill HB 40. I just think conscience rights are important, and it's important to understand what really conscience rights I think really are. I mean, conscience rights should include the ability to refuse to participate in activities that one finds morally objectionable, but also the ability to refuse to cooperate in activities that one finds morally objectionable. And there's many people of faith who are involved with the medical profession. There are some nuns and religious orders who are willing to provide free or low-cost health care to people in need. I really don't think we're going to require nuns to refer for things like abortions or in vitro fertilization or sterilizations or other things that they just might find objectionable or contrary to their faith tradition. So again, recommending a no or a negative recommendation on this piece of legislation, and I'll wrap up my time early. Thank you.
Thank you, Doctor. I now ask for questions from the committee, and I see Delegate Kaiser.
Thank you, Madam Chair. I just have a question for Ms. Bogley based on something she said about Delegate Ampre's bill and an AG opinion. And this is just a yes or no question, but did you ask Delegate Rose, Erickson, Adams, Metzger, McComas, Cox, or Weibel about having a Attorney General letter?
It's a good question, Delegate, and you should know that Maryland Right to Life always solicits bills that have survived federal court challenges.
But that's not my question. Did you
liability
ask them?
restrictions.
Did you ask those sponsors if?
I am answering your question. I'm not in need of an AG's opinion on that because other federal courts have already ruled that this type of policy is constitutional, and that's why we solicit those bills. We're very selective about that. Thank you.
Okay, I will remind folks it is late. It's been a long day and we still have some work to do, committee. Are there any other questions from the committee members? Seeing none, that completes the hearing on House Bill 50 and the work before us today. As far as bill hearings go, the HGO committee will begin its voting session in 15 minutes. It is now 6:35. The voting session will begin at 6:50. So committee members, please take a little walk around the building and get yourself something to snack on, and we'll see you back here or back on the voting link in about 15 minutes. Thank you all and have a good evening.